Шановні перекладачі, є в англійському каналі This is English Channel. Can you hear? Чи чує хто-небудь в англійському каналі перекладачів? Будь ласка, скажіть в загальний канал, чи хто-небудь чує перекладачів в англійському каналі? Будь ласка. Ага. Супер. А давайте Yes, okay, say something. The drug and alcohol, security of the society, the protection of minors and psychic health. What do we have to know about the... Yes, and... А давайте... Good afternoon, our esteemed participants of the conference and our viewers. I have the honor to open this panel today. This will be dedicated to medicine. We'll be talking about treatment of different disorders, psychic and behavioral disorders in the result of consuming psychoactive drugs. Before our speakers will tell about this problem, and this is something important that our state should realize. I would like to talk about some of the issues related to medicine, and I would like to say a couple of words about how our panel will be organized. After my introduction, we will give the opportunity to speakers to say a few words. Then at approximately 10:40, we'll have a discussion panel where we will ask 3 or 4 questions to our speakers, and we would like them to participate in this discussion panel. And then we'll be able to use this to develop the maximum perfect piece of legislation and start the reform in the sphere of medicine, in the sphere of psychotherapy of persons who depend on different types of PADs. So medicine. We understand that medicine is one of the most important sectors of our life. When we're talking about any state, the quality of the standard of life in the state depends on the standards of medicine. When we see how the state takes care of people working in the medical sector, we can understand how the state takes care of the population. But when we are talking about how the state takes care of the people who work in psychology and psychomedical sectors, that means how the state takes care of the public security, because very often the psychic disorders of people in the result of drugs and alcohol addiction could become a factor for committing the crime. I like one word, which is called medical social rehabilitation. It's a very comprehensive term. We've been researching this problem, and we pay attention to the fact that it's very important that this person can again re-enter the society, so that the person resolves all the problems related to addiction. So these are, first of all, the internal problems of a person, and that's some situation which has triggered this situation. That is the assistance in employing a person, in communicating to relatives and families. It's assistance to families. We need to explain to them what and how to communicate to a person who is addicted. I'd like to talk about the problems in this sphere, and I would like to tell you that together with Anna Mishchenko, when we launched this project, we talked to our leading doctors, lawyers even, because we get them involved into this work, because we need to draft the legal acts. We appreciate all those who communicated with us and who's ready to communicate with us. And now I had the honor to communicate to one of the doctors, there's Gennady Zilberblad, and he outlined 4 major blocks in the sphere of medicine. First of all, these are personnel, finances, material and technical basis, and legislation. And these 4 things in the future, when I started researching it, I realized What a wonderful model it is for understanding how to find ways of resolving the problem. When we are talking about personnel, do we have enough specialists in Ukraine? As you can guess it, no. Unfortunately, we don't train enough specialists in our country. There are many problems here. That's also the issue of salary for these people. Where they can get employed. And that's basically the issue of the HR policy in our state. If we take the addictologist, this is not identified as a separate profession, even though these people participate a lot in psychological rehabilitation of people. Besides, I'd like to say a few words about funding. People who are getting into the situation of addiction. These are people who don't always have money to pay for treatment themselves. When a person comes, the person understands how much this medication costs, and families don't always are not always able to cover all the costs, the minimum cost needed for treatment, medical treatment of a person, and especially at the first stages, people cannot start it without medicines, and the final stage would cost about 20,000 hryvnias. Later, it could be twice more expensive. It's when we're talking about high quality assistance to a person and rehabilitation. We understand that the package of free services, which every day, every year is allocated per person, is not 20,000 hryvnias per person. So this is something that is to be addressed. We need to understand how to cover all these costs, because people who are drug addicts, they cannot do it themselves. Another thing is material technical basis. And that's everyday question. Where, in what conditions the medical services will be provided, or the services of medical social rehabilitation. As we understand, everyone was in some state-owned institutions, not even medical. Even when we enter the courts, they look like very dilapidated buildings. And such institutions are not funded well, are not supported well by the state. They cannot provide for normal conditions for work of doctors, starting from facilities, equipment, medicines, medical equipment, laboratories which are available, even the gown. This is the money which people need every day. The next issue is legislation. As you know, and we'll be talking about that today, we have the problem with the standards and programs of treatment. Methodology should be recognized as the standard. People should understand what would be best for the person. Unfortunately, not for all types of PADs. All these standards are introduced in Ukraine. We need to understand what standards we lack and what we need to do. But what impresses most is the prevention, issue of prevention. Unfortunately, we don't have the system of prevention. And that is one of the first steps when we want to overcome something, we need to prevent it. There's no system of prevention in our country now. Another issue is coordination between different state bodies in the medicine, in providing psychological and psychic assistance. It's about how this mechanism is coordinated. For example, everyday situation with law enforcement body takes a person in a crisis state to the institution, and the person should be given immediate medical assistance. It is important that law enforcement bodies should not forget that their work doesn't stop at the door of this medical institution. It is very important for them to ensure the security and safety for people who work in the medical sector. When the doctor understands that there's no threat to his health or life, then they can tell about that to the representative of law enforcement bodies. And it is important to have the cooperation between the doctors and law enforcement officers. We need to understand that the health and life of doctors sometimes could also be endangered. We have to protect them. Also, I'd like to say a few words about prevention, but in the context of examining the situation in the country. When I started looking at that issue, well, there were several reports made in our country, and I opened the report on drug and alcohol situation in the country for 2020. There was one of the provisions there in Ukraine, the research on the drugs and alcohol addiction, the category of 15 and 60, from 16 to 64 years hasn't been done. That is why we don't have the information on that. We do not know how extensive is the consumption of drugs and alcohol in the country. Some surveys which are done, they are not done by the state. They're done with the assistance of some European initiatives. The survey is connected to the problems of drug addiction in Ukraine are conducted by different NGOs, and that is part of the international assistance provided by international organizations. Almost all such surveys are conducted by not the state, by different NGOs. I have a question as a lawyer. It's very difficult to plan the strategy. It's very difficult to plan some activities when we do not know exactly what the problem is. But we do have the methodology which has been approved, and we hope that very soon we will see new figures and will understand that our state has started researching this issue, even though in other countries there are standards and methodologies. We are quite a grown-up state to start different research and surveys. And in the end, I would like to talk about us, about citizens who get medical assistance. It's very important to be aware of the problem, to understand at what moment the person, myself or anyone else, requires medical assistance. To understand it is very important. But another issue is where to go with that. We'll discuss it today. So in the end of this, my introductory speech, I would like to announce our first speaker. Allow me to welcome him. That is Maxim Tkachenko, who's the deputy head of the faction 7th of People, the first deputy head of the Parliamentary Committee on Human Rights, Deoccupation, Reintegration of Temporary Occupied Territories in Donetsk, Lugansk Oblast, and Crimea, as well as Sevastopol. He will talk about the issue which is so important, and that is problems related to drug addiction in Lugansk and Donetsk regions against the background of hostilities in the region since 2014. Esteemed Maxim, the floor is yours.
Good morning. Good morning to all the participants of this very important conference. Thank you very much for introduction. I am a member of the Verkhovna Rada Committee on Reintegration of the Temporary Occupied Territories. Although it sounds like this parliamentary committee is not directly involved in the issues which are the subject of today's conference, and it may sound like it is it should be the subject of my colleagues from the Law Enforcement Parliamentary Committee, but nevertheless I was approached with the request to describe my opinion on this issue in the territories of Donbas region amid the situation of the armed conflict. As a representative of this very region, I'm familiar with the problems which exist there, and I would like to say that the Donbas problems are not limited to the armed conflict, to illegal trafficking of arms and weapons, and the continuous threat to life. Unfortunately, joblessness, insufficient protection by law enforcement agencies, drug addiction in general, in both regions. The sound had disappeared. Sorry, no sound. Of course, some problems existed even before 2014, but from the very beginning of the armed conflict, the amount of problems has been growing rapidly. 7% of respondents in my survey mentioned that they were drug addicts, 17% were dangerous to their relatives, 38% took things from their families to sell them. Then 16% had stole things from their neighbors. Unfortunately, the sound is being interrupted, and only 20% of drug addicts applied for medical service in special treatment institutions, and only up to 40% of drug addicts mentioned that it was very easy to get psychiatric drugs in their settlements and towns. Having heard about the terrible statistics, I started to search in the internet, and I found a post about request of bribes from drug addicts for hiding the evidence of the petty crimes, was registered in the national police teams in Luhansk Oblast, and it is reported that the officers of the National Police Battalion had organized a special corruption scheme requesting bribes from those who were blamed in illegal trafficking and circulation of psychiatric drugs. Those law enforcement were detained in line with the provisions of the criminal code when they were caught at the moment when they requested for 15,000 hryvnia of bribe from the drug addict. I'm not reading this post in full, but this nevertheless proves that here in Kiev, at the level of the National Police Command, the attention is insufficient. All my experience here in Kiev within the last 18 months and my work in the parliament had shown that the Ministry of Internal Affairs is very much preoccupied with the anti-drug work, but unfortunately at the local level there are some officers who whose integrity is very poor, and they do these things. And of course, the law enforcement agencies have to tackle the problem, should tackle the problem. The gray zone along the conflict line is a favorable place, favorable territory for illegal trafficking of drugs. And of course, the civil population, which are under stress, which are in depression, is a favorable raw material for the spread of drugs. You can see how this is reflected in statistics, in generally available statistics. I believe that in Donetsk and Lugansk region, we have to take special measures to improve the situation. Doing this, we have to remember that organization of treatment and rehabilitation of people there should be aimed at post-traumatic syndrome and treatment of depression. This would require a special approach which should be applied by specially trained specialists. This sound had disappeared again. The sound is being interrupted, sorry. This here the additional support is needed, and additionally to the parliamentary committees which are directly involved in this type of activities, another parliamentary committees should be involved, like our parliamentary committee on the temporary occupied territories. Again, no sound, sorry. Maxim Mikolaevich, thank you very much for your speech. Unfortunately, due to technical interruptions, we haven't heard the very end of your speech, but we understood the overall message that the MPs are ready to interfere and to tackle the problem, and we have to study the issue to which extent our Ukrainian citizens who remain in the occupied territories, who suffer from the post-traumatic syndrome, who suffer from depression, and they become extremely vulnerable to drug addiction. And we will find out how to deliver the proper treatment and rehabilitation to these people, and what is needed from the parliament. Thank you.
Allow me to welcome our next speaker, that is Igor Linsky, the director of the Institute of Neurology, Psychiatry and Narcology of the National Academy of Medical Sciences of Ukraine. He'll be talking about the following topic: what you should know about the spread of states of addiction in Ukraine. Esteemed professor, the floor is yours. Thank you. I hope you hear me well. So let us start. You see my presentation. Okay, what do we need to know? A lot. And that is why I would like, I'm sorry, Professor, can you hear? There is something with this sound. We don't hear you. Can we check the sound, please? Okay. Mr. Professor, it's on. We do not hear you. Please turn on your sound. You have muted your microphone. Это не, у нас все нормально.
the sections and the ways of treatment and intervention for the proved methods, outreach, screen. Have felt that that a vision had changed. I mean the vision on the development of addictions. And today it is very important to distinguish between the use, abuse, and addiction. I paid attention that our international colleagues use all those terms very carefully. In Ukraine, we mix all those terms. Please bring back the previous slide. And in Ukraine, we mix these notions. Any type of use is driven by the market demand. Abuse is the use which results in harmful effects for the users. For example, abuse arises when a person takes a drug or psychiatric agent, substance, and then starts driving. But this does not mean that this person is an addict, and it has disorders or diseases, while addiction means the all sorts of harmful effects for the health, and all the three terms require different measures to counteract them. Either we would prevent the market dissemination, or like with the use, or with the abuse, we should prevent any actions by a person who had used drugs or taken drugs, or when it comes to the addiction, this means medical treatment and social rehabilitation. Next slide, please. I decided to show this very slide because the working group members pointed out to the difficulty how to reach agreement as to the terms. And the biggest discussion and argument was around treatment. What does it mean, treatment. And it seems to me that you will find out the same difficulties about treatment. Then the group members decided not to ask the question, what is treatment, but to ask what the treatment should do. And in this case, we managed to reach consensus rather quickly. So we agreed about 4 criteria. First of all, to decrease symptoms, to cut down symptoms, to decrease the risky behavior. The third is to improve functioning of a person or its ability to function. And the fourth is to improve the health status in general. So this is about the results of treatment. The meetings of this group took place in 2015, 2016, and in March 2016, the draft document was agreed and passed and approved by 198 member states, and then it became a subject of field testing, so to say. Yesterday, much was mentioned about the need of public funds allocated for these purposes. The mentioned document says that the standards may set the standards for the state funding. She is quoting from the document how the funding should be allocated, whether the intervention will prevent from harmful impact of health, whether the second, whether the intervention will ensure social rehabilitation, whether the intervention will promote the decrease of harmful effects on health and social behavior. So I would like once again insist that you should keep in mind use, abuse, and addiction, and that each type of these terms requires different approach. Then I would like to point to the first section of the document, which is called the principles of treatment, and the principle of accessibility, attractiveness, and ability to resolve the problem. In Ukraine, we used to have a similar system in the past, which and that system was designed in line with the needs in the past. Today, we have to shift emphasis and change the organizational structures, which should comply with the needs and be accessible of those who use drugs. The next principle is about compliance with ethical norms in course of treatment. Yesterday, several times, our foreign colleagues very softly pointed out to the voluntary nature of treatment, voluntary nature of application for treatment. All the documents, all the international documents prove that treatment could be efficient only when it is a response to the voluntary application of the patient. The next principle is to ensure good coordination between law enforcement, medical workers, and social insurance workers, social protection workers. I was very pleased to see participants from the Ministry of Social Policy yesterday, and I was happy to see that they suggested some provisions which fully comply with the international standards. Then the next principle, treatment should be based on the research evidence and provide good supported treatment. The next principle, that treatment should take into account different age groups and apply appropriate approach. For example, for pregnant women, for men, for imprisoned persons. That is when people take amphetamines, and they should get medical help not early in the morning but after midday, for example. The seventh principle, these are integrated practices, services, and the treatments, and those practices should be subject to continuous monitoring and evaluation, and this is not built up in our country yet. The methods of treatment, this is the second section of the same standard. The first is based on the outreach work. It deals with the conditions, objectives, approval of methods, etc. That is, all the information should be approved and based on the existing practices. Actually, the practices are all existent, but they should be adapted and applied in Ukraine. The next is screening, short-term interventions, and direction to treatment. I decided to devote more attention to this issue. We started to work on this in the International Center for Technologies Exchange, but the approved recommendations are in place, and the WHO document from 2012 suggests that if a patient uses cannabis or psychoactive drugs, when they're revealed in non-specialized medical institutions, they should be suggested for short-term intervention. The short-term intervention should comprise one time 5 up to 30 minutes treatment, including individual feedback and recommendations about limited decreasing use and up to full stop of the use of cannabis and psychoactive drugs with the following measures. So this should be included into our national standards, and our medical workers should be instructed how how to do this because this decreases the development of addiction for certain categories of patients. The next intervention is a short-term inpatient treatment in hospitals, etc. In Ukraine, this refers to our standard psychiatric clinics where the short-term intervention may last up to 4 months, but the way how it is interpreted in the standards and comparison with Ukrainian practice shows that our practice is different. It should be slightly changed, maybe amended, but change its ideology, but not to cancel it. The next is outpatient treatment. Outpatient treatment is very powerful everywhere in the world, but not in Ukraine. In Ukraine, it's very weak. And nevertheless, we have some organizational structure in place which could be improved. And we should not cancel, ruin this system and only slightly improve it. I decided to demonstrate that in back 2015 WHO recommendations said that situational impact and cognitive behavioral therapy and family therapy could be suggested for the treatment of addictions from psychoactive drugs. Psychosocial interventions based on cognitive behavioral therapy and stimulating therapy could be recommended in course of treatment from cannabinoid dependence. Then she quotes the same document about the further psychosocial interventions which could be used for the treatment of alcoholic addictions and which are recommended for the use for outpatient treatments. Actually, this is what is offered by Ukrainian rehabilitation centers where they offer treatment up to 24 months. But the standards say that these patients could stay in psychiatric hospitals. But today in Ukraine, we do not provide any funding for the patients who may stay in psychiatric clinics for 24 months. And actually, this is a deviation from these recommendations. That is, we have to discuss how much we can do to improve, to approach to these recommendations and allow the outpatient treatment and inpatient treatment up to 24 months. Then in Ukraine, our attitude towards addictions as a disease which exists like on temporary basis, not like a chronic disease. And we should change this attitude. There's a special groups of patients, very special groups, pregnant women, newborn babies, which are under passive impact of opiates in wombs, children and teenagers involved in the use of psychiatric drugs and pain relief addictions. And when we do not have documents about alternative treatments, this document might become very useful for us. The document speaks about the low-risk patients and organization of the trial, observation, probation, and or community bail for such patients, and it prevents from patients being taken out from their families and communities. This is based on the conventions aimed at counter drug spread. Ukraine has signed these conventions but do not apply them fully. This type of work is gaining more and more popularity, and many countries are looking for opportunity for alternatives to detention of drug addicts, and especially they are looking on local and territorial communities and trying to apply supervision over drug-related person, which could be alternative to detention, and it obliges such person to undergo necessary periodical tests to comply with some obligatory conditions, participate in the groups of mutual assistance. Actually, this is based not on punishment, but it is based on encouragement of a person who wishes to get rid of the addiction. And this produces many positive results. This is the last section about organization of services to drug addicts.
Look at this top triangle. This refers to the inpatient hospitals, and all these measures, they are quite costly, and if we request funding, we need to understand what for, either to work with the group of those who are consumers, or those who are addicts, or those who abuse, whether we need to use the inpatient or outpatient forms of treatment. In this document, there's a list of interferences which can bring positive results. And I believe that after that conference, we need to pay attention to this document. It would be very useful if we adapt this document at least to minimum standards for the countries with not very stable economic situation. And then we will try to use in our country the optimal standards of this document. Thank you for attention. Thank you, Irina, for your presentation. You explained all these problems which exist in this sector. I could not imagine that this problem is so serious, that there are so many issues which are to be examined thoroughly. And thank you for talking about the issues of science and practice, that they're interrelated. Unfortunately, that's the problem of any sector. But when we are talking about the health of a person, it hurts to hear that we have this problem. And even the terminology, what we call these things, that is of importance. And the principles, that the checklist against which we can check our legislative initiatives, the issue of financing, what are the criteria, that is also very important to understand how to ensure financing, and all the documents that we need to look at. We are for conducting this reform at high quality. As my colleagues tell me, there should be no technical problem anymore. And I would like to invite Igor Linsky to take the floor again. We do hope that now there will be no technical problem. Can you hear me? Can you hear me now? Can anyone hear? Hello. Can you hear me? Yes, we hear you well. Now, can you see the screen? Yes, we hear everything and we see everything. Thank you. Then let us start again. I cannot move the slides. Okay, let's talk about what we need to know about the addiction. What will I be presenting now? First of all, what is the difference between consumer and addict? That is what Irina Yakivna mentioned, but we'll be talking about that from the point of view of morbidity. We will then talk how the psychoactive drugs depend, how they influence the probability of forming addiction. We'll be talking about morbidity, about the factors which have an impact on the morbidity. And also we'll talk about what are the genetic and environmental factors which affect the addiction. What is the difference between the consumer and the person who's addict? Any person who used some psychoactive substances, that is consumer. Alcohol, for example, many people consumed alcohol at least once, but the addiction is formed not with all the people, not with all the population. When people are talking about consumption or addiction, it is very important to differentiate between these things, because medical statistics is using the term addicted persons. And when people criticize the statistical data, they say that the statistical data do not cover all who consume alcohol and who are addicts. Those who consume without any significant impact on the health, those who abuse of alcohol, and those who are addicted, these are different types of people. What does it depend on? Whether the person will move from the category of consumers to the category of the addicts? That depends on the properties of the substance itself, on the addictive potential, whether the substance can cause addiction. You can see the rating of the addictive potential We received it from the survey made when we examined the senior school children and students. The most addictive potential has the tobacco. It's not considered to be illegal drug, but those who depend on tobacco, they know how difficult it is to get rid of this addiction among even young people. Those who had the experience of consuming but tobacco when they are young, even 27% of them already have all the signs of addiction. Then there are substances that you can buy in any shop, and that basically is seen here on this graph. That is again the result of our survey. We interviewed about 1,500 respondents, and then the result of the consumption of tobacco, the risk of getting into dependence is increased so many times. And these are the risk of consumption, of consumption of cannabis, alcohol, psychostimulators, the tea and coffee, and others. So you see those who are dependent on or addicted to opioids, they had the experience of consuming first tobacco, then alcohol, and those substances which are affordable and which people can easily get, can easily buy. These are, of course, tobacco and alcohol. And now let's talk about how does the situation look in dynamics as to consumption. We are talking about consumption now. The international organizations, the world, global international organizations, they publish different reports. This is the report on global status report on alcohol and health. If you compare year 2010 with the 2016, you see that Ukraine was consuming 15.6 liters, and you see that the consumption of alcohol in Ukraine got reduced, and we moved in this rating closer to the lower part. If you look at the reports which describe the consumption of tobacco, there was also certain reduction. If we take both men and women, we had 27 tobacco consumers. Last year it was reduced, but we went up in rating because in other countries of the world, the reduction of consumption of tobacco was happening even faster. Every year another report is being published, and that's World Drug Report. And again, if we compare the years 2008 and 2008 to 2012, then you see that the situation hasn't changed much. We about 2% of the population consumed almost 2% of cannabinoids. And talking about coke, we see certain increase in 28 that was like something exotic, but in 2015 we registered a significant increase. As to the so-called ecstasy, that also happens, and that's at the level of the era from up to 0.8%. So now looking at our domestic statistical data, it's very often criticized. People say that that's just the top of the iceberg, but once we're using this metaphor iceberg, we need to say that looking at the top, we can judge what the underwater part is. If the ice is melted, then the iceberg is getting lower. And what we see, our institute is collecting medical statistical data from 1954, even 1953, the year of the death of Stalin. Before that, there was no statistical data. Now what we see two waves of the epidemic of addiction. And that was during the last 70 years. First, that was the wave of addiction to alcohol, and the scale is different. You see that for alcohol, we use the left scale, and for drugs, the right one, which is 4 times smaller than alcohol. And the peak of this epidemic was in the beginning, basically the beginning of the famous anti-alcoholic campaign, Gorbachev's, and the peak of drug consumption was in 95, 96. At that time, the number of fresh cases registered every year was reduced by 3 or 4 times. Why this happened? Why? How this affected the medical statistical data. We'll talk about that later. Here you see alcoholism and alcoholic psychosis, and that is when it leads to delirium. And if you compare this alcoholic psychosis, we cannot but pay attention to the fact that after the crisis, after the disintegration of the Soviet Union, we see a very high degree of correlation between these two types of addiction. If we look at this period attentively, we will see that at the same time, there were the events happening, not just that refer to drug addiction, but also the dynamic of suicides was changing same way. Then, sorry, the first graph is wrong. The number of suicides, the total death rate of the population, and why it is so, it's easy to understand because I have enumerated all these markers of social not well-being. It was the time of very difficult economic and not just economic crisis. 94 was the worst year for Ukrainian industry when the plants were closed and the people were not paid salaries. And in a year or two, we saw the highest levels of alcoholic psychosis. And we see the very high level of registering drug and alcoholic addiction. If we look at the data of our American colleagues, we will see this red arrow. They show Russia, and that's 1981, that's times of the Soviet Union. You see how the number of people who felt themselves happy was reduced from 70% to 40% in Russia, and in Ukraine down to 35%. And those people who did not feel happy in their country generated many people who became addictive to different psychoactive substances. And the birth rate in Ukraine, fewer people were registered. You see this dynamic of birth rate. You see that now it's almost 53% lower than in the beginning of our independence. And we have fewer children, fewer teenagers, but we know that at that age, the first contact with all these substances happens, and this cannot support the same level of morbidity, but only in such circumstances the morbidity was reduced twice. So that was actually not the result of our efforts, but that was the result of a demographic catastrophe that we've been observing. Then shows the accumulated morbidity that is with the exception, morbidity with the exception of those who either recovered or unfortunately died. I use old terms because new ones are very difficult to use, so to save time, I'll use old terms which professionals do not use now, but they are quite easily understood. You see that the total number of those who were patients in 1987, we had the peak, and then it was reduced mostly because there are fewer people who are alcohol addicted, and most people were those who were alcohol addicts. But in the recent years, we saw certain growth, and then it was stabilized. So looking at the latest 20 years, that's the period of independence of our country, here we see the years where we see the alcoholic syndrome, and we see this piece, that shows this part of the territory which was annexed in the result of the war with Russia. And that is why we have information from a less number of people. Now we see how the specific weight of drug addiction and alcohol addiction was changing, but talking about main psychoactive substances, non-alcohol, here we saw very interesting changes. We see non-opioid and opioid drugs. For opioids, there are the protocol, the substance therapy, substitution therapy, sorry, but in the developed countries, there are no protocols which would allow to treat these disorders. You see the dynamic, and I will not provide comments as to the specific weight. You see that the share of opioid drugs, of all those which are made from poppy, goes down, but the number of other drugs goes up. The designer type drugs, synthetic, the highest specific weight is have so-called poly drug addicts. That means the person who uses different types of psychoactive substances. This could be so-called salts, coke, but this is poly addiction when people are addicted to many different types of drugs. The second one is cannabinoids and other psychoactive substances. That is those people who are addicted and who were registered by medicine, but this graph does not show those people who are who were not using any medical assistance. By the way, what figures are quoted? People say that medicine is just 1/5, 1/10 part of consumption. We conducted special research, and we can say the following. For example, the drug addiction is not the disease which you can hide. It's a difficult type of disease, and sooner or later the person get to medical institutions, and this period of hidden development of the disease lasts for approximately 3-4 years. But there are people who for 15 years are not registered. And that depends on the rate of the development of the disease. I would like to say a couple of words on whether there are approaches which would allow us to make any forecasts according to some data that falls under the general law of population ecology. That is very important. It describes, you see this curve, which you know, and it describes how the number of new members of population, those who are addicted to alcohol or drugs, how does that, is that correlated with the those who recovered or who stabilized. So then first we have parable, and then it gets to the point of stabilization. And this is how it's happening practically, same way it's happening in our data. And this is the population of the Earth. And it is expected that the number of population will be stabilized at the level of 10-11 billion citizens. Now, again, we look at the addiction. These curves have very similar parameters. If we describe that by the such a parable, we see that we have passed this point of the highest development, and now the conditions are changing. And here the information has, formation has changed. We have a new country, we have the demographic crisis, and that's why we see the reduction, and we cannot describe it like in the past, but now there's critical. What do we have from that? We can learn about the energy of growth of the population, and the second is we can see that the energy of growth of those who depend, who are addicted to alcohol is lower than those who are addicted, it's higher than those who are addicted to drugs, because, you know, why the energy of growth of alcoholism is higher than this curve of drug addiction. People say it's very easy to get drugs, but it's much easier to get alcohol or tobacco because they are absolutely affordable even. And in the result, we can say that out of these figures, we see that the person that is addicted to drugs produces fruit, so to say, every 3 years, and the person who's addicted to alcohol every 2 years. But that's not the person who's doing it, but the state, because the state advertises both alcohol and tobacco products, and that's the price of the advertisement of alcohol and tobacco products. And in the contribution of of the consumption of psychoactive substances into general psychopathology. We see this is Ukraine in 2017. The latest data is a bit different. It's more difficult to now compare this data, but nevertheless, 2017, we see that the consequences of acute intoxication and other consequences of consumption of alcohol account for more than 50% of hospitalization cases. Here in 2017, almost 80,000 people were hospitalized, and the same situation with accumulated morbidity. More than half of all the psychopathologies in Ukraine were caused by the consumption of psychoactive substances. You need to understand what's the problem. What is this problem of consumption of such substances for our society? And in the end, I hope I still have some time left. I would like to talk about what is the contribution of the environment and genetics into the development of the addiction. We examine the families of addicts, and if we take every one of these addictions, the percentage of the genetically caused and environmentally caused are different. You see, first first goes the alcohol, then other substances, tobacco, and non-chemical. But I would like to draw attention to that slide in order to calculate what is the contribution of genetic and environmental components. We need to look at the fathers and grandfathers and in all types of addiction, the transfer from category category fathers, grandfathers to today happened in such a way. I used to hear that those who consume psychoactive substances lead to the growth of genetic factor, but here you see no mistake. Now the environment that has in our environment there are so many psychoactive substances. There's a lot of information about them, and they're easy to get, and even those who basically those people who don't have any genetic reasons to start consuming these substances. The environment, I don't mean by environment the quality of air, but by environment I mean that these substances are easily available and affordable. So on the one hand, such environment has become toxic, but on the other hand, unlike genetics, we can influence the environment, and we will be cleaning our environment. Basically, I talked about all these things. Thank you for attention.
Thank you very much, Igor Volodymyrovich, for such a broad presentation. We had seen what does the addiction in Ukraine look, and Thank you for all your data information analysis of that data. Unfortunately, the governmental and state reports are unable to present this material in all its fullness, and we would like them to be equal to the profound level of your presentation. I like very much your slide about the risks of gaining addiction and becoming an addict. Is very informative and very instructive. Thank you very much. Thank you for fruitful work. And the next participant of our panel is Ms. Olga Myszakivska, who is a young professor of psychiatric and psychotherapy of the Lviv National Medical University. Disorders in result of psychiatric drugs addiction. So the report about disorders in result the abuse of stimulators of amphetamine nature, specificities and approaches to treatment. We're connecting you. Olena, the floor is yours. Good afternoon, dear participants. I'm Olga Myszakivska. Thank you for the invitation to this conference. Today, my first report will be devoted to the abuse of the amphetamine drugs. I would like to point out your attention to the pictures of a woman who has been a drug user within 10 years. The first picture was made at the age of 20, the last picture at the age of 38 years of age. The amphetamine substances stimulate the speed of the neural signals in your brain. They are, those drugs are used both legally and illegally in some treatments, or and illegally they are used. They could be in any form, in a form of pills or pastures or powder, etc., and abusers use them in a form which is harmful for the health. This group includes many compounds which have jargon names. This could be cheap or expensive. This could be the mixtures which also contain the baking soda for smoking mixed with amphetamines. Stimulators have similar structure to dopamines, which is important chemical substance in your brain, naturally produced by your body when you feel satisfaction. And the natural stimulators of the dopamine production of food or sex, and these pictures show how the levels of its production depend on the stimulator, and the strength of it depends on the type of satisfaction. The stimulators are able to increase dopamine levels in your brain, and here on these graphs you see the comparison between methamphetamine, cocaine, nicotine, ethanol, etc. And there's a very strong action on your body by amphetamine, and in your nature you cannot find the analogs to this. Amphetamine acts in the part of your brain which is responsible for satisfaction and happiness. Methamphetamine could be compared to cocaine, although they are similar, but the effects are different. Cocaine could be taken out from your body and could be fully accepted by your body with time, but methamphetamine behaves contrary to that, and this means that the harmful impact of methamphetamine is much higher than the one of the cocaine. Without further biochemical lectures, I should say that induced disorders, the disorders induced by methamphetamine are much higher, while the cocaine users experience better health situation after 8 hours. This slide represents the scans of brains which demonstrates the decrease in dopamine receptors and compares it with the cocaine abuser. These changes in brain are responsible for the development of of the brain functions. These are long-term effects of cocaine abuse. The top picture shows a brain response of a normal person. The middle row shows the brain 10 days after the use of cocaine, but the lowest row shows the brain after 100 days after the use of cocaine, and the biggest concern is that the brain could never be restored. The acute and harmful effects, intoxication of stimulators, they cause the dysphoric moods like anxiety, irritation, all sorts of psychosis like paranoia, like suspicion, hallucinations, then it is after 15-30 minutes of euphoria, people should feel anxiety. Between 40 and 80% of persons which have disorders in result of stimulators report about psychiatric symptoms in situation of intoxication, and the use of psychotic is connected to the high level of suicides, suicide result in depressions, etc. This slide demonstrates other effects for harmful for health and the skin manifestations, the skin reactions. Quite often there is a compulsive sense in the skin. The cognitive function of a person is also negatively affected. Then the way of taking drugs into a body also results in harmful effects for the nose, the mouth, etc. And here, this picture shows the teeth of methamphetamine users. They are able to, they gradually lose teeth and in result of the majority of destructions of teeth. Abstainment syndromes from methamphetamines are not painful. The syndrome, abstination syndrome, develops within several hours after a long-term abuse of these drugs. And currently treatment from treatment of cocaine and methamphetamine abuse is based on the treatment of behavior, correctional treatment of behavior. And we build up our methods of counseling based on this. The treatment may last up to 90 days with a consequent 9 months support, and within this first 90 days, a person should attend the clinic once a week, and then this supervision could be extended up to 9 months, and the urina tests are recommended for the periods. And currently we carry out studies of various substances which could be used to prevent harmful effects of amphetamines on brain, like, for example, the cocaine vaccine. So these are behavioral methods of treatment. Brain scans are important for for corrective treatment. Our patients quite often are unable to perceive emotions of other people. This could be related to the to harmful brain changes which are not subject to restoration. How we can help? We can change our protocols of treatment and to increase the frequency of treatment sessions, etc. I have finished my first intervention, and during my second presentation, I will describe ISOP. I hope you can see my next presentation, International Society of Substance Professionals. I would like to introduce to you International Society of Substance Professionals. I'm honored to be a coordinator of this society in Ukraine, and I would like to encourage you to join this society. ISOP is a global, non-commercial, non-governmental organization which unites professionals in the substance area. We unite 24 national chapters. We unite those experts who work on the counteraction to drug abuse, and in 2020 almost all the ISOP events were carried out online, and this amounted to more than 19,000 participants, and from 154 countries. We are an organization opened for organizations and individual members. We are open to experts, to doctors, to nurses, to family members, to politicians, decision makers, activists in this area, etc. ISOP is funded by the State Department Bureau of the United States on counteraction to the international substance circulation and law enforcement activity, INL. ISOP very closely cooperates with the International Consortium of Universities for Drug Demand Reduction and with Global Center for Attestation and Certification. We use 3 channels of information supply: digital information channels like website, networks, social networks, information, bulletins, which is disseminated on monthly basis. Then ISOP events, international conference and webinars. Within last year, we delivered 177 seminars and workshops, and of course, local branches or offices of ISOP in each country. country. We offer professional development and training through our website. We offer training materials in English language and other languages, database about training. We open access to providers of training and announcements about vacancies all around the world. ISEP has a huge library containing new publications, new research, news resources, etc. From 2015, we organized annual conference. Last year it was held online in the African regional, and we hope that in 2022 we will have the annual conference in Abu Dhabi offline. The national office coordinates ISEP mission at the national level. It receives technical support from the ISEP headquarters. In Ukraine, we function under the Psychiatric Institute under the auspice of the Kiev National Taras Shevchenko University. You see our offices elsewhere in the world. The role of ISEP in Ukraine. First of all, we exist for promotion of scientific knowledge in this area in Ukraine, and to unite all the experts working in decrease on the drug demand in Ukraine. We aim to ensure better access to all the stakeholders to training. We offer job opportunities, and we are always happy to welcome new members. Thank you, Olga Mikhailovna, for your presentation, and it is extremely informational. I have understood that if a child abuses drug or uses drugs, and we know how it is harmful for her body, you cannot just punish this kid. You cannot just lock it in, lock it at home, but you should explain how harmful it is for the body, and for those people who are ready to use psychiatric drugs. Those who want to prevent people from doing this, please disseminate very broadly the presentation which we have just seen. Unfortunately, the treatment which we can offer at current stage would not allow to restore the functioning of your brain up to the original level. And before taking psychiatric drugs, take into account how this will influence your future life and the future life of your family. Thank you, Ms. Mashakivska, for your presentation. I would like to mention that all the presentations of our speakers during these 2 days will be posted on our platform, Social Dialogue. They will be publicly available on the condition that the speakers allowed this access and publication. Those who would like to receive or to get access to all our materials, to be able to review all our recorded sessions, I encourage you to register on our website, and we will disseminate our invitations to you also. I'm happy to invite to the microphone.
Several voices in the air. Several voices in the air. This is from interpreter. The translation is impossible. So Sergey will tell us about people who consume the stimulators, drugs and alcohol, and also the report about the survey that was conducted. Sergey, please take the floor. Greetings, esteemed colleagues, friends. Thank you for inviting me to presentation to this conference, because a lot has been mentioned about how important the topic is. I now would like to present some results of a pilot study we have done in Ukraine to define what are the main needs and obstacles to access to medical treatment. That study was done by sociological company with participation of our office. Same was done in Ukraine, Belarus, Moldova, Kazakhstan, and Uzbekistan. In some countries, the design was different of this study, of this research, but there are data that could be compared, and there are data that could not be compared. What are new psychoactive substances? We've mentioned that these are the substances which are not controlled by the single convention on psychotropic substances, but their consumption could become threat for the health of people. And now there is a draft legislation which also adds that these are substances which are not part of the regulation of the Cabinet of Ministers number 270. You see now that approximately 271 million people in the world at least once consumed psychoactive substance in 2016, and almost 35 million are addicts. Also UN generalizing the global experience and also practices of non-governmental organizations, scientists, doctors, is working on developing different standards and reviews of literature. I show only some of them, which UNODC published in 2018, 2019, 2020, and 2021. These are the research that were done with the support of our office. They were published and they are available in Russian and English. Now, a few words about this research. It was done in April 2020, and that was the beginning of lockdown, of pandemic, and we had to change the design of this survey and the methods of how to reach the consumers of the psychoactive substances, but we would like to at least understand how this process is taking place, how the consumers are not so often clients in the services of treatment. You see that the restrictions were that this was non-representative selection. In the beginning, we had the problems with the identifying the methods of how to reach those people, where to find these people. The respondents were selecting what to talk about, so we cannot guarantee that the information is absolutely correct and honest, but we accept them like they were. We do that to understand at least what is happening on the territory of these countries. The objective was to identify the main needs of the consumers of new psychoactive substances or stimulators and to find out what are the obstacles to get access to medical and social services, as to prevention, testing, and treatment of HIV. And the objective was to identify the focus of advocacy efforts to achieve the goals of strategy UNAIDS 1999. The task was to identify and analyze actual models of consumption of stimulators and substances in Ukraine. I will be talking about, I will call them all stimulators, to identify main needs as to accessibility of medical services for representatives of different communities, identify the main needs as to accessibility of social services, also analyze problematic issues and barriers which do not allow to get access to services, and also suggest the ways of attracting new clients. That was a cabinet, it was an office studies. Also, the method was focus group discussions, and it was anonymous online interviews. These were different people, they were using different forms of communication, and we were also using our partners from organizations which had access to our target groups and who were could guarantee that these are mostly those people who consume stimulators. These are unique clients and they do not repeat the answers. And I will show who we were working with. The target group were consumers of psychoactive substances and stimulators, sex workers, men that have sexual relations with men, the clients of women of sexual workers and transgender people. We did this in 2 cities of Ukraine, and Kyiv and Odessa, which according to the strategy of UNAIDS are identified as fast-track cities. In total, 258 respondents were interviewed. Out of them, 49 participated in focus group discussions. It was important for us to understand how to reach the clients, and the criteria of selecting the respondents were like that. The representative of target group, which is above 18 years old, living or residing in Kyiv or Odessa, the time frame of the time of consuming substances is not less than 90 days or 3 months. Also, these participants agreed to participate in our survey, and also the participants had to agree. We had no information as to gender composition, and we did not have any gender quotas. These are the questions which were asked during our survey: the types of substances and practices of how they're consumed, what popular stimulators are consumed, the practice of consumption, consumption of alcohol, at the background of consumption of substances, access to receiving stimulators, and especially the access to receiving stimulators during the lockdown of COVID-19, because that was the first stage of lockdown. The main needs of the representatives of communities, how often they visit medical institutions, are they getting tested, are they treat their diseases, or do they refuse from medical services, whether the respondents know about the risks for their health. Also, we were whether they understand the risk of injection consumption of drugs, whether the patients participate in ZPT programs. Very often the respondents who consume stimulators are at the same time consumers of opiates, and some of them are participants of the program of substitution therapy. Do our patients know about pre-contact prevention? Do they know what is the assistance in case of overdosing? Where do they get information from about HIV, about STDs, medical and social services? We also examined whether people know about social services, whether they need social services, whether they need services of psychological assistance. We examined whether there are obstacles in the access of representatives of these groups to the services, how they perceive the readiness of the system to provide services, how consumers assess the quality of medical services. We also examined their relations with state and non-state institutions, their relations with the police, for example, and we were trying to study whether there is a joint consumption of stimulators, how sexual relations are related to consumption of alcohol and other substances, whether they use lubricants, condoms, how they communicate with their relatives, and how that influences the use or non-use of stimulators, how does that influence their the ability to get medical services, where the friends are involved into testing, where they get psychotropic substances from, who buys them, who gets them, how and where. Then the diagrams. In Kiev, we had 122 respondents. These were the clients of women, sex workers, men who have sex with men. 56% didn't refer themselves to any group, but there are people who consume stimulators. In Odessa, 109 persons. Again, that was 53% who said that they are not consuming stimulators. There were several clients of women sex workers, men who have sex with men. So we have achieved that. The gender distribution, you see, in Kiev, there were more men, in Odessa, more women. People, that's how people identified themselves, talking about age distribution. In blue is Kiev and red is Odessa. In Kiev, we were lucky, so to say, to reach youth more from 18 to 24, and in Odessa, we reached more people of middle age and elderly, and we had fewer young people. Distribution of participants of survey according to categories and age. You see on the top are mostly clients of women sex workers, those who are older, sex workers and men that have sex with men. These are mostly young age, and the same is true talking about men having sex with men and sex workers. People who do not refer themselves to any population, we had most of them in these two groups, and 59 years. We can compare these categories now. How often do people consume psychoactive substances? We registered answers, and we were trying to assess whether they were true or not. People were saying that for the last 90 days we were not consuming amphetamine, or they were not consuming other substances, and we were not trying to, we were trying to find out whether they were consuming some other substances. But we can see here that the responses were once 3 times a month, 1-2 times a week, and 3-4 times a week. Kyiv is in blue, Odessa is in red. We have quite an active consumption of amphetamine in Kyiv and Odessa, and even lockdown did not affect the accessibility of the substance, and respondents were reporting that the situation has become more complicated, but they are using other methods. As to MDMA, you see it's mostly consumed in Odessa, in Kiev 1 to 3 times a month. Methamphetamine in the form of powder crystals in Kiev more often. In Odessa, 19%, almost 25%. Amphetamines, they are not as popular, but you see that Kiev during lockdown, you see the frequency in Kiev. That is, that means that these stimulators do not cause such addiction like opiates, and respondents and patients, they are mostly consume them as recreation stimulators, but that doesn't mean that there are no people who are not addicted. And there's a photograph of a woman who for 10 years has been consuming methamphetamine, is an evidence of that. Then we were trying to find out what's the knowledge, awareness, and what are the preconditions of consuming medical and social services. And here, that was from people who know nothing and to people who know very well. This slide shows the preconditions and obstacles, personal qualities, readiness to open the status is correlated to full hiding of the status or diagnosis, the care of own health and absolute disregard of health, use of medical and social services, precondition. There's a trust to medical workers. There's understanding that the medical examination should be taking place regularly. People are talking that there's no stigma. from medical workers, and they believe that the services they received were of high quality, but absolutely different answers. People are afraid to go to medical institution. The experience or fear of the stigma and discrimination, and no information about possibility to get social services.
Awareness, and again, awareness fluctuates between the full awareness about the risks about alcohol addiction, abuse of psychoactive substances, non-protected sex, etc., about HIV, hepatitis, etc., and the full adversary to it, full unawareness about the same. Relations with sexual partners, family members, and friends also fluctuates and varies from the full support, understanding, readiness to accept and deliver help, openness to testing, and to the reception of social services, and up to the full unawareness about risky behavior of a respondent, the health problems, opportunities to help us to such a person. Here we have a big space for our work, for spreading information, for raising awareness. We managed to discuss the things with the users of stimulators who never had been questioned, and they clearly expressed their fears that they did not want to address full state support. They had experience of communication with non-governmental organizations, etc. Some people from that group were very well aware. They were well informed about the threats and the harm. Now, I suggest how the results of the survey could be introduced into practice. Currently, we work on the contract to be able to involve the way, to develop the way how a web outreach to such patients could be developed. We plan to offer 10 services. They prefer in general to use online information, online services. That's why we plan to produce 10 videos to post them on a website. And this will be used as a general source of public awareness, of raising awareness, information, and we also want to work closely in cooperation with NGOs, adapt available methodologies of treatment, and to cooperate with narcologists, with infectionists, physicians, in order to be able to offer a minimal package of services for the interested parties. This is a team with whom we carried out that survey together. Alexandra Yatsura and Lilia Tarasuk coordinated the research and methodologies. They entered and processed data. And due to the lockdowns, we had to review our primary approach to redesign the methods. And our colleagues assisted us in the access to the these closed communities of drug users, and there's a survey. Of course, is unable to answer many questions which may arise, but it pointed out some bottlenecks, and there's allow us to project for further work in this area to offer the Ministry of Health programs how to tackle the problems of the target group, and in general to offer the response to the problems which Ms. Pinchuk described in her presentation. Thank you very much for your attention, and goodbye. Thank you, Sergey Anatolyevich. New psychoactive drugs is a huge problem. The more we will study, the more impact on the human brain we will understand, the better will be treatment and prevention. And we would like to draw attention of the state to research which is done in this area. And especially when it comes to newest and state-of-the-art drugs. You mentioned amphetamines. The last month in the Dnipro, law enforcement officers discovered a production of amphetamines in the amount 1,200,000 doses per month, 300 kilograms per month. This proves that the demand on amphetamines is quite big in Ukraine, although some part of those drugs could be produced to import them to other countries. So our task is to raise the awareness of people and encourage them to seek for help and to prevent them from the use of drugs. And thank you for your survey. And now I am honored to invite our next speaker, Ms. Irina Ivanchuk, head of viral hepatitis and the substitution maintenance therapy division of the Public Health Center of the Ministry of Health of Ukraine. The topic of presentation is as follows: regulation of the diagnosis of mental and behavioral disorders associated with the use of surfactants. Existing diagnosis system as a barrier to treatment access. Irina, the floor is yours. We can hear you, Irina, we can hear you. Good afternoon, dear participants. I would like to start my presentation. Unfortunately, no sound. I would start my presentation from such a simple statement that all medical interventions should be based on the research and proved effectiveness, and they should be well grounded. There were many discussions about treatment, but I would like to discuss the point of first access to medical treatment. That is about diagnostics. So the main objective for the effectiveness of medical services is to describe clear rules, clear algorithm to the patient how to act. And if you impose any impediments on this way, then the diagnostics and future treatment would doubtfully be successful. I would like to describe legislative framework and regulations that allow free access and streamline the consequent medical services. So the procedure of diagnostics in Ukraine, diagnostics is carried out in line with the International Code of Diagnosis. And we have two legislative sources which create legal collision between the law on psychiatric aid and the law in Ukraine on protection, on counteraction to illegal circulation of narcotic, drugs, psychiatric, psychoactive substances, precursors, and the abuse of them. And one of them is purely medical, the other one more law enforcement, so to say, of law enforcement nature. Then we have the law on psychiatric aid, where we have the notion of psychiatric disorders, and that they are diagnosed by the psychiatrist after special testing with the aim to appoint treatment. At the same time, the law about illegal circulation of psychoactive drugs deals with obsolete notions like drug addiction, which is absent in international code of diseases. And based on that terminology, the latter law is based on the secondary legislation, which law should be applied in the first turn the law about psychiatric aid should be high in category and applied on primary basis against the law on counteraction to illegal circulation of psychoactive substances. But in practice, everything is different. In reality, the diagnostics is carried out and the treatment is carried out based on the second law, and the diagnosis is the diagnostic period is not regulated, and it takes up to 10 days, and the minimal period is 1 day, the average was 5 days, and the maximal 13 days. And unfortunately, due to poor financing, quite often this are put into inpatient clinics. So the procedure includes interview and all series of tests, all sorts of oral tests. Some of them are needed based on the international standards, but some of them are done optionally in Ukrainian hospitals. And if we calculate all the time needed for carrying out all those interviews and tests, we may find out that this is not all necessary. So this main test, which should be carried out, takes a short period of time. It does not require the in-hospital treatment, inpatient treatment. And there is a big question whether such tests, which are not recommended by the proven practices, whether it is needed in general, or whether some additional tests like all sorts of ultrasonic tests, whether they are required for the diagnostics of psychoactive disorders, etc. This is a big question. Then we carried out a survey among doctors and asked them whether the diagnostic should be carried personally by one doctor or by a group of doctors, team of doctors, and they have assessed the advantages and disadvantages of each of them. And if the purpose is to deliver aid as soon as possible, then perhaps they should be done by one doctor in outpatient clinic, and while the inpatient testing takes longer time. in reality, the preference given to inpatient diagnostics reflects the fears of doctors that they would not get sufficient funding, employment, etc. So we had analyzed the fears underlying the responses of our survey respondents, and found out many disadvantages that those fears produce. And here on the slide you can see them. This relates to the subjectivity in decision-making, hyperdiagnostics, prescription of non-necessary tests, than the cases when drug addiction is simulated, or the possibility of corruption and bribes requested by doctors. We have the medical standard as to the behavior of and procedures that should be followed by doctors. That is, treatment should be started within 1 day after setting the diagnosis. And having analyzed the experience of other European countries, we found out that they carry out diagnostics quite rapidly, and only in some cases they prescribe tests to reveal psychoactive substances in the patient's urine. And but this is not a widespread practice. And sometimes when they wish to establish the presence of any infection like hepatitis, etc., they prescribe additional tests, but this is not obligatory. Also, conclusions and recommendations: we should bring our regulatory base in correspondence with the international practices and approaches in order to speed up the diagnostics and to make treatment more efficient.
Thank you very much. It's very interesting, the topic that you were talking about. I understand it's not just a difficult, but very sensitive topic, and there are discussions going on about that. Everything should be analyzed clearly, and we need to introduce the standard which will not scare our patients from having diagnostics. There will be no corruption factors or other factors which could impact this or that system of diagnostics negatively. And we will include that into our resolution, that we'll send the draft resolution to all our speakers, so that we absolutely correctly put in words everything. And I would like to invite our next speaker to take the floor. Our next speaker is Natalia Bill. Unfortunately, the interpreters now hear the discussion between the technical services. The translation is impossible. Thank you. I would like to thank the organizers for inviting us to this international conference, and I would like to thank such presenters as Irina Pinchuk, Professor Linsky. There was a great report from the Lviv. Such conferences are very important, very needed to all the services who are involved in addressing this problem. And especially when it comes to drug addiction between the minors. Dnipropetrovsk region is one of the biggest regions in population, and we have some successes in dealing with the injection drug addiction every day. There are people who are on the substitutional therapy, but we are concerned with the group which is disseminating the psychoactive substances among minors, among the youth who are 14, 16 years old. And that is such a topic which makes the situation very complicated. It's very difficult to prevent the situation. We have all the substances which are in Ukraine. Now, for many years, we had the only one rehabilitation center for minors. It was the center with 30 beds, and they were addressing all the issues. There was a school, there were psychologists, psychotherapists, and that is what we had. But unfortunately, now our rehabilitation for such categories of youth has become impossible. I would like to talk about some practical issues, how this situation could be addressed, and I believe that we are on the right track now. In 2021, when we had when we have the COVID, our prevention work was somewhat limited. Our regional council and the members of the regional council are now supporting the idea of prevention. In March, we formed the coordination council, which includes the representatives of the Department of Education, social services, police, medical workers, and only this way we can tell to adults and to children how psychoactive substances affect people, not just when they consume, but in the future as well. In March, we received 3 guys. They were 15 years old, and they were poisoned by drugs. That was a disaster for children, for parents. And doctors said that the situation was very difficult. Then we put parents into the ward of the hospital so that psychologists talk to parents as well, because when it comes to drug addiction of minors, that's all happening in the family. And we have social workers, and social workers in this case are former patients who help our patients now to change their life to the sober type of life. because that disease actually affects all the social issues. In the end of April, we had a meeting and we summed up the results of the work of Coordination Council for a month. And it's nice that we listen to our psychologists, to our narcologists, and in March, in April, in May, they visited, we visited large towns in our region. We went to schools. In some cases, we were making different presentations online. And this team of psychologists, of physiologists, and we went to practically all schools in such town as Nikopol. Today, Pavlograd, one of the largest industrial towns, out of 19 schools, we visited 10 already. These are not just meetings when we tell school children what is a drug. We tell them, what do you consume today? Do you know what it is? The children start laughing. Usually it's 46, 50 people present. We had 120 students present in one of the schools, and we tell them about the consequences. We tell them about how not to take the drugs. And I believe that in the first, there should be a lot of prevention work carried out, and then treatment. But we are talking about prevention, how not to take drugs. How will it affect you, and how will it affect in the future? We talk about how the drugs change behavior, and then in the future, this will lead to different infections and undesired pregnancy, for example. So that is all caused by the consumption of drugs, narcotics. I cannot show you the photograph. Okay. The result of our 2 months work. You see in the back, you see what children write about what drugs are for them. When they listen, they say, no, we'd better go for sports, or we'll start painting. What is very difficult for us? We don't have parents who would listen to us. When the lockdown ends up, we will meet parents, not just online. That's good, but it's great when the discussion goes offline. And the parents who survived the tragedies with their children, that is a close topic for discussion in the family, with the relatives. But this topic should be present. Parents should know, and family psychotherapy is the basis. Parents should know what is it related to. Our task is to educate parents, to see the first signals, what is cannabis, what are powders. For us, for medical people, it would be great to know all the medical standards, but the skills of how to work with the teenagers, with the parents is important. It is great that our authorities help us in that. That is the service which is needed, psychological, narcological service is needed. And also I would like to say that drugs, street drugs, light drugs, as they say, and that is also leads to some other type of addiction, game addiction, gambling addiction, computer addiction. These things are all interrelated. We'll be working on that, and we have good contacts with the authorities. There are police officers in school. There's a program, Police in School, and we would like to also cooperate with social services. All the situations related to that, well, the social workers come to us and they say, we know that there is a family, there is a child, and this child brings drugs to school. The teachers know about that, and we don't know what to do with them. We need to teach social services what to do, how to do it. Then we will be able to liquidate all these consequences of drug addiction. We had some teenagers who were in reserve of some sport teams, those who were 16, 17 years old. They were in sports, and the consumption of amphetamines, all that basically liquidates, eliminates their personality, their future profession. The main practical service is important. We'll be working on everything that is related to prevention and treatment, of course. And the outpatient rehabilitation that we do have it, we have psychologists, but we would like also to have inpatient rehabilitation. It's impossible in such acute cases to treat a child in outpatient clinic. The child will run away from parents, from the family, but some limitations. There should be inpatient treatment up to 21 days. That means that we will be able to explain to the teenager that it's very harmful to consume all these psychoactive substances. Please show us photographs. It would be great if you could see how our students react. They see the booklets that our regional council published. They see our attitude because we are kind, we understand the teenagers. Each teenager believes that his or her or she are grown up, but they are teenagers. They want to hide something from parents. And we talk about how this teenager should be perceived, how to help him address all his issues. The drug, every child is, with children, some are leading, some are led. If a child is led, he or is a leading one, then such child will be offering drugs. But then we explain that to teachers, we are trying to tell that to parents, and there will be a big chance, opportunity to talk to them. We are planning to visit summer camps. In the future, we'll be visiting schools. So even in May, we will be able to do a lot till autumn. In summer, we'll do a lot of work. And please look at how children are listening to us, how they're reacting. The teachers are interested. The Department of Education is interested. And the teachers of the schools are interested. and we say that they shouldn't hide what's happening in schools, in classrooms. We are practitioners and we can tell how to get rid of that addiction, how not to take drug. Then we will not have to treat this addiction so much. That's all I wanted to share. Thank you. Thank you very much for your presentation, for sharing with us this important work. The issue of consumption of drugs by children is very important. The earlier a child learns about these things, the earlier they will get rid of it or will not start consuming. That's important for professional development, for life, and for safety of our citizens. Thank you for what you're doing. And I would like to address you with the request. You were talking about booklets that you're publishing. We can also send them to our audience. People can get registered at our website, and all those who got registered, we will send you all the materials of the conference, everything that we will receive from our speakers. Thank you for your presentation, and I would like to announce the first part of our panel, which was which was given for speakers is over, and we will make a pause for several minutes, but stay with us. We would like to organize the general discussion of all our speakers. Thank you, speakers who are still with us. In a few minutes, we'll be back. Thank you. Our esteemed speakers, thank you for staying with us. We are here just ladies, and we will ask you some questions. We would like to ask you 3 questions. If possible, please, everyone, answer this question based on your professional experience. And the first question I would like to ask.
The first question is about standards. That is, what do we have in Ukraine as of today and what should be done? That is why, as of today in Ukraine, we have insufficient standardization of treatment for addictions and what could be designed, regulated, and registered in order to be able to discuss this. Now let us decide about the turn of your answers. First, I would invite Ms. Pinchuk. This is a good question. I think that it has a long history, so to say. And the absence of something does not mean that this is bad or good. This only reflects our history, and this only suggests that the issue of standardization had appeared at some moment. As far as I can assume, this happened in 2005, 2006, when the Ministry of Health had produced its order, and we started thinking about the protocols. At that time, we we did not think about the standards, because the standards had to be approved by the Ministry of Social Policy. What are the main shortcomings of this work on standards? That it requires a lot of effort from volunteers in extra work time. And due to this voluntary effort, we required a lot of effort from us, from those who were ready to translate the existing practices. In one country, I've asked why your rehabilitation law was passed after 5 years of setting the standards, and they answered that it took them 5 years to reconcile all the experts and to come to agreement about the standards of treatment. You can think about Ukraine, and we are even bigger country, and the difference in ideas which exist among experts, it prevents us from taking standards. And the second is a very rigid system of regulations. Our attitude, our mentality, so to say, requires us to have obligatory regulation to implement it in our everyday practice. Thank you, Rina. I would invite Ms. Mashakivska to express opinion on this issue. I agree with Irina Yakivna, and the only thing which I might add is as follows, that any standards which are passed in any country today, they have to pass some period of adaptation. And if we discuss something today, it does not mean that it would remain in force or adequate in 1 year. And I hope that we are now approaching to the final stage when the standards would appear. I am very much supportive as to the idea of standards. This is a big area which should be filled in Ukraine, and the difficulties in developing the standards and the financial aspects of this issue. These are serious obstacles, and many people contribute on voluntary basis, and we have to think carefully how to balance the best practices and the what the state can afford, so to say. And that is to assess the opportunities of the state. And on the other hand, we should not reject from the best practices under pretext that we cannot afford them, that the state is unable to finance them in full scope. That is, we have to write clearly in our legislative framework what should be provided by the state obligatory. Unfortunately, we cannot hear you, Rina. Look, we are having very interesting conference today, and we have experts at our discussion. Today, we have heard from Irina and from many others that we have a huge lack of research, like practical doctors, practitioners, addictionists. We are ready to participate in research. We are ready to do practical things in order to establish and to develop necessary standards. And I agree that the standards are very much needed. Thank you, Natalia. Let us let us continue our discussion. My second question to all of you, which perhaps might sound rather sensitive, introduction of the electronic system for monitoring of psychoactive drugs prescriptions in order to prevent abuse of psychoactive drugs. Whether these electronic prescriptions of such drugs can resolve the issue. Can you please repeat the question? This is about electronic legislation, electronic prescription of psychoactive drugs, and whether it is important to monitor the circulation and electronic prescription of psychoactive drugs. I believe that digitalization is important and it will happen. It may resolve the issues, it may tackle the issues when patients visit several doctors and get prescriptions from them, and such electronic system would prevent duplication of prescriptions, but it cannot be established separately from the overall digitalization in the in medical sector. The second, it seems to me that within last 15 years, I'd been dealing with a complaint from a woman. She asked me a question, the electronic system of registering diagnosis and personal data, and she asked who will protect them, who will get legal access to it, who can enter information in the database, who can get access to it. This is extremely important issue in our country, and in general opinion, the country is not prepared to the universal database of diagnosis, etc. Thank you, Ms. Mashakivska. I agree with you that the system is needed and the supervision over the system is needed, and the personal data protection is needed, and I believe that it will be resolved. Ms. Irina Ivanchuk, the question is topical and as far as I understand, this would resolve the problem of excessive prescription of psychoactive drugs. It is this system has proven positive impact, and especially in the cases when patients abuse their medical services, but and this again requires standardization with clear indication what drugs and what doses should be prescribed to what groups of patients. But in practice, it is not so easy to follow the implementation or the practice how those substances are prescribed. So the electronic system of entries about prescriptions of these drugs. And in case the patients would try to duplicate prescription of these substances, we would immediately reveal it. And of course, finance allocated for this purpose is also very important. Based on the results of our today's conference, perhaps those in authority would pay attention to this. Ms. Pinchuk. I wanted to add an example. We all have banking cards, and you can follow, you can track all the transactions just like in the bank card. Why it is not follow up to all the prescriptions? Miss Natalia, the floor is yours. And please press the key. Turn on your mic. Turn on your mic, please. Okay.
Now we can hear you, colleagues. In Dnipropetrovsk region, the electronic prescriptions are made as to our constitutional therapy. Yes, the group which is registered. What is in non-electronic form? This could be sedative preparations, those which are not controlled by the pharmaceutical network. But I am for digitalization, but there should be no access to these issues. Our patients are very sensitive to that, and no one needs this collecting information. As to the drugs, yes, we will then see who prescribed, what was the dose, who and what for. here the control is needed. And I want to support our main specialist. We can see you come for substitutional therapy. You go to the registrar's office, and the same should be in the whole system of registering and recording. Thank you, Natalia. And our last question, every one of you has some professional experience. The question is, looking at the problems you are faced with, so what three main components should be done to improve the work in your sector? What would be step one, step two, step three that would improve your work? Olga, probably, yeah. Thank you, Irina. Thank you for the question. First of all, we need to address the issue of financing, then coordination of our efforts, of our international cooperation, and we need to pay attention to our clients and their families. Our approach should be comprehensive. We need to unite all the efforts to achieve better results. Thank you, Olga. As far as I know, you need to leave. Thank you so much for your participation, for your position. And again, we will disseminate all the presentations of our speakers. Thank you for inviting me, and goodbye. Irina, I would like to specify 3 things to improve our work, right? What is important to either improve the situation in general or your specific work? What could improve it? I believe that the first one despite where I worked, but I believe that there should be a constructive interaction between state-owned public institutions and experts, practitioners, researchers, academia, those who are in educational sector. I mean, different ministries should work in close cooperation. Now we all have some achievements in our spheres, and we often do not know what's happening in some other sector. There's practically no platform where we could share our works, our achievements, and maybe then we'll make 2 steps ahead if we know that something has been done already by some other people. So there should be multidisciplinarity. And we need to have some platform where we can work in close cooperation. Second, talking about the issue of how to create this service, I understand that the practice is more developed because there are needs and people have to satisfy the needs, but the science and the education, they are lagging behind the practitioners because there's no funding, and the educational programs are not up to date. When I started working in Shevchenko University at different departments, I realized that stigmatization and the issue of psychic health are not considered like it is done in other countries and in other universities. I was impressed. I was in Poland at a study tour, and the teachers receive information about psychic health and psychological health of children. And third thing, people say that we don't need to look for funding. The funding is there, but the funding is not rationally distributed. There are many programs, many research, much research is done by some NGOs. I believe that somehow we need to change the financial mechanism of scientific research institutions so that they can accept different money grants to conduct research, and after that to implement the results in the state. Because the money spent by such organizations, then they are not sometimes allocated properly. Thank you, Irina, for your position. Irina Ivanchuk, yes, Irina Yakivna said a lot of things I agree with, but one more thing I would like to add. What's lacking is the understanding of the problem, because the abuse or addiction causes leads to lots of emotions. And unfortunately, very often, we don't look more rationally at the situation. We need to understand really what this problem is about. And then, based on the experience of other countries, we can introduce the best practices, and we depend on emotions a lot. And many people, this is the topic that causes a lot of emotions, but that distracts from a real resolution of this problem. Also, an issue of tolerance is of importance. Our community, I mean doctors, civil servants, those who are in education, they need to think about clinical evidence a lot. And that is to add to what Irina Yakivna said. Thank you, Irina. Natalia Bila. I'd like to support my colleagues who spoke. There are three main things. First of all, financing of all spheres of activities. Without money to tell just let's do that or let's do this is impossible. Basically, in May, we still don't have money for certain things. And yesterday we were saying, okay, our team that we have, let's work hard. Let's understand that the situation is difficult in the country. Yes, this could take place, but the main thing is financing, then the team approach, which is so important, and high professionalism. In the medical institutions, there are plenty of young specialists with great experience of their work in times of when they were students. Okay, thank you, Natalia. Thank you all for participation in this conference and this discussion. Thank you for sharing your experience, sharing your problems. We will include all that into our resolution and then we'll send it to you so that we can publish it later. And I would like to address our civil servants. We are ready to do everything to consolidate our efforts to organize the systemic approach, thanks to our experts who join us and who will join us. But that is one thing that we lack. We need to have a little bit of political will. And then we would like to have the support from our members of parliament, of our civil servants. We need political will, and then we'll be able to change the situation in our country and get to the level of European countries. And maybe we may become an example for others. Thank you for participation in the conference. Let's keep in touch. And thank you again. Thank you. And I would like also to say that from 2 p.m. we start another block of our conference, which will be on rehabilitation. So our viewers, please come to us back, and then we'll be talking about rehabilitation. That will be starting from 2 p.m. See you.
Good afternoon, dear colleagues. It is 2 p.m. sharp now, and we resume our conference, and this will be the fourth panel devoted to the psychological and social rehabilitation. We will discuss the rules, regulations about the centers delivering these services, about fire protection, and about the experiences of those people who dealt with the rehabilitation centers, either in a capacity of a patient or as their relatives. Even now, we have preserved the inherited attitude towards rehabilitation centers. On the one hand, these are treatment facilities where people restore their social skills. On the other hand, these are institutions which may remain beyond the legislative field, which may abuse human rights, or alternatively, they became the centers of scandals in mass media, where they became subjects of readership or various violations. I'm not an expert in rehabilitation, but society perceives the rehabilitation centers in 4 different categories. The first type of them are similar to detention facilities, where the heavy addicts are sent to isolate them from families and resolve their psychiatric problems. Although this might be not purely lawful to do this, but nevertheless, this is how it works. The second category of rehabilitation centers are places where psychological and medical and social support is offered to the patients. The third type of institutions could be characterized as purely illegal because they use patients for forced labor, for economic slavery, and other types of violence and slavery. And today we will discuss how to turn all those multiple types of institutions into the facilities, reputable facilities with good standards, practices, which would be able to cooperate with state institutions like employment service, law enforcement services. And so this panel will be devoted to the rehabilitation centers. And first, our speaker will be Mr. Kuhn. And after all the presentations, around 5 p.m., we will start our panel discussion and discuss what should be immediately done in order to bring these institutions to the best international standards. So I would like to introduce our first speaker, Mr. Kuhn. Perhaps all the in rehabilitation centers are interested in the fire security. That's why we have invited oh, sorry, I've changed the turn of speakers. Deputy head of the second department of the first division of the migration police department of the National Police of Ukraine. And Mr. Kuhn would discuss criminal offenses that are committed under the cover of rehabilitation centers. Good afternoon, dear participants. First of all, I would like to thank you to the organizers for the sufficiently professional level of the conference organization. I believe that due to this conference, we'll be able to cover the topical issues. I'm deputy head of the human trafficking department. During my 18 years in this area, I became familiar with multiple ways how people could be exploited. A big part of our work is devoted to prevention of crimes committed by the members of organized crime groups, and quite often we deal with the victims of human trafficking in human beings. And some dozen years ago, the young women were the major objective of the trafficking in human beings, and they were forced to this via involvement into the drug addiction. And in 2018, we discovered the activities of one organized criminal group who involved their future victims into forced sexual services via addiction to the psychiatric drug, which was brought from the territory of Russian Federation. And as of today, we find out that during the last 4 years, we observe grave crimes committed by persons in the situation of drug abuse under the action of chemical substances. And in this situation, people are kidnapped, forced to labor and to exploitation. You may recollect that quite recently there was a terrible blaze in the care house for elderly people in Odessa. And after that event, we undertook the massive inspections of all sorts of institutions, and we have discovered almost 10 centers where the illegal activities were carried out. In 2020, we discovered 4 criminal groups who used forced illegal labor of their victims in Lviv, Kyiv, Odessa, and Zaporizhia Oblast. Thus, victims were brought or involved into drug abuse, then drug addiction, and they had, and families had no other way out than to put them into rehabilitation centers, which and pay for that. In some centers, people or victims, better to say, had to do forced labor, and all the financial income received for this forced labor, they were used by the owners of that centers. Sometimes the patients of such centers were brought to the centers with violence, forcibly, and sometimes we discovered kidnappings of the patients who were later transported to these centers. Quite often we discovered physical and psychological violence against the victims. From beginning of the year 2021, we had found 3 criminal groups in Lviv and Kyiv Oblast, and in Kyiv, where the forced labor was used. That criminal deeds are fall under Article 133 of the Criminal Code of Ukraine, which provides for the punishment up to 10 years of prison. But with violence, this may amount to 15 years with confiscation of assets. When we look at the legislation, including Ukrainian legislation and international legislation, involvement, transportation, or hiding of a person with the objective of kidnapping or involvement into forced labor is a punishable deed. And after our inspections, we have discovered that some rehabilitation centers are state facilities, while the majority of them are registered as private enterprises. Also, we have found that in some such rehabilitation centers, the services which could be offered, they do not correspond to the requested or needed level of medical service or treatment. And moreover, there were cases when the owners of such centers say that they do not have enough money for the fire alarm system, and nevertheless all the territory is equipped with the ICCV equipment. Then this probably means that this is done with the improper purposes. So keeping in mind all the aforementioned information and From my experience, I know that the drug addicts are, who commit crimes or even petty crimes, they very seldom go to the rehabilitation centers voluntary. And having heard the reports at the conference, I understand that this is very important. Thank you.
Thank you for being ready to join us. We will ask you questions during our panel discussion. But now I would like to invite our second speaker, Igor Shiglov, the head of the Board of Directors of International Anti-Drug Association. Ladies and gentlemen, I am happy to participate in this event. I am from the International Anti-Drug Association, which since 1991 has been implementing the program of psychosocial rehabilitation of people. Our organization has been always socially active and responsible organization. And the main objective of the organization is bringing young people to full-fledged life. The long-term and short-term social rehabilitation is one of the methods according to the international standards of treating disorders, which were approved by the International Organization and WHO, and also during the time of existence of the association, and also we work abroad in such countries as Georgia, Moldova, Kazakhstan, Azerbaijan. And from the very beginning of existence of the rehabilitation centers in Ukraine, we were working in three directions: the labor rehabilitation, religious rehabilitation, and psychological rehabilitation. We are working within the system of psychological rehabilitation. This activity was never regulated and was never controlled by the state in Ukraine. It led to criminal cases of violating human rights on the one hand, and on the other hand, to the abuse by the law enforcement bodies in order to identify the issues. Our organization is conducting the campaign, advocacy campaign on protection and promotion of rights of organizations which provide services to psychosociological rehabilitation. In 2017, the Cabinet of Ministers of Ukraine passed the resolution number 741, typical provision on the Center of Social Psychological Rehabilitation. In 2020, we participated in the development and passing by the Ministry of Social Policy of Ukraine of the state standard of social services of social psychological rehabilitation of people with the addiction, drug addiction, And we are working on these standards. Besides, our organization initiated the unification of similar organizations in Ukraine which provide the services of psychological and social rehabilitation. So we have to, our association provides the services of social psychological rehabilitation, and the main tasks of this association are ensuring following the human rights and the harmonization with ethical principles in the centers of rehabilitation which represent these organizations. We would like to draw your attention, the attention of the participants of the conference, to the fact that together with big successes and achievements, we have some of the unresolved issues in Ukraine. And these are as to transparency of functioning of such sentence. And there's no register of receivers of social services. There are no clear mechanisms of how providers of such services should be included into the register. This register is the only one in our country, and not any other single agency has any similar register, but there are many difficulties with as to what the organizations can do with that. Also, there are no regulatory documents which would encourage organizations to get involved into rehabilitation. And that is also a very important issue. As to the state support, in the recent years, we often see the fact when people are illegally detained in the rehabilitation center. Unfortunately, the translation is impossible because we hear some dialogue. The regulatory documents were developed. And with that, we recommend during reacting to these applications to realize how a person got into the, to analyze how a person got into the rehabilitation center, whether that was registered by the video and whether the conditions of staying there correspond to respective standards. Only after checking of such information, different procedural actions could be applied. We cannot violate any other, we cannot work on other issues until we resolve these issues. Thank you for attention. Thank you, Igor, for your presentation. You're right that the centers are not protected, but as you've mentioned, most of the centers existing in the country are not certified and they do not correspond to the standards. They do not match the standards which you developed previously. So now at our panel discussion, I suggest that we need to think about what needs to be done so that this situation is changed by law enforcement bodies and by the centers, because the situation shouldn't be one-sided, like either someone is good or someone is bad. Center is the business. These are not just the facilities that provide some assistance. But first of all, that is business that works and earns money, and that is business which has some social burden, and we need to find the balance which would satisfy both the state, the centers, and the patients. Thank you so much. And our next speaker is the deputy head of the Department of Fire Security from the Department for Emergency Prevention of the State Emergency Service of Ukraine, and Evgen Glinchevsky. Good afternoon, dear colleagues. I believe that all of us are colleagues here because we are all trying to do something to coordinate the activities of the rehabilitation centers on the territory of our state and to create safe conditions for people who stay in these centers. Now, the issue of fire security is much discussed in the country. We all remember these tragic fires which were happening in different social facilities, and rehabilitation centers could be considered to be part of such facilities. You all remember this fire in Kharkiv, when in non-registered facility for elderly people, we had 14 victims. After that, there was a fire in the house for elderly people, a facility for elderly people in Kiev. Fortunately, we avoided any victims there. And recently, unfortunately, we have more and more fires with victims. After the latest fires, our service conducted inspections of the facilities where people are staying. These were not just social facilities, but the hotels, hostels, the rehabilitation centers, which officially function in Ukraine, facilities for elderly people. And during the first quarter of this year, we inspected more than 3,000 of such facilities, and we identified 38 violations of the requirement of fire safety. But the biggest problem is if the centers, such centers function officially, then here at least we can interact with them, we can inspect, we can advise. But the main problem is that most of such centers are opened without getting registered, without any documents or permits for this type of activity. They are in the housing sector where no controlling body like the State Service on Emergency Situations doesn't know that they exist. And that means that we cannot inspect such a facility, we cannot correct any plans of fire extinguishing, and even, but in this case, the rehabilitation center differs from a regular house. We had many discussions on how to ensure fire safety there, but the problem was that these are not really medical institutions. These are just regular houses, and we need to take into account the fact, even though most of the people who are there, especially those who want to get back to normal existence in this society, those who want to get rid of their addictions, they're trying to do that. But we need to take into account that there are plenty of specific features that people who are there have. And the requirements to fire safety should be much stricter. If we are talking about some big rehabilitation centers, which will be built from the scratch, especially for this purpose, then there are certain requirements of the state construction norms. There's a special regulatory document, VV2, and these rules cover the buildings for social adaptation, the centers for homeless people. There are construction norms of how to build such centers. But the question is, when these centers are organized in some other premises, we have the rules of fire safety, which are confirmed by the order of the Ministry of the Interior of 2014, even though this is quite a thick book, but it's divided into certain sections. And if the center is being open, people have to train people who will be there. You need to develop certain plans of evacuation and instructions. Such measures do not require any big financial expenditures. But when personnel is there 24 hours a day, when they know how to act, where to call, how to call the police, how to organize the evacuation of people, such knowledge could reduce the probability that there will be many victims in such institutions. I want to say that from the point of view of fire safety, it was correctly mentioned that many owners of such centers say that serious capital expenditures are required to prepare such centers and to make them really protected from fire. There should be the alarm systems installed, but it was mentioned correctly that such a system of fire alarm, it doesn't cost much more expensive than the system of video surveillance or other systems. Besides, in order to legalize the activity of such centers, I mean, from the point of view of fire safety, people are afraid of the state bodies. They say it's a big problem to get permits to commission such centers. Talking about fire safety, the real estate facilities can be used after the certain declaration is submitted, and the declaration should state that the facility meets all the requirements of fire safety. All that should be registered. So people do not have to receive the permit, they just have to register such type of a declaration. Basically, the declaration is a checklist of what should be available. There are things like there should be instructions, the personnel should be trained. This declaration is not very complicated, but when the center is open, we know that it exists, we can cooperate with it, interact with it. in order to help not just rehabilitation centers, but help any institution in communication with our representatives in each of our departments, in each region of Ukraine. We have consulting centers. Before you open the facility, before you submit the declaration, any citizen, any entity can come to the center. This will not be inspection with some consequences, with some fines or penalties, but the advice, the consultation will be provided so that all the work is legally organized.
As we have heard today from other services, we also, as a service, are ready to cooperate in drafting of legislation, the secondary legislation for the rehabilitation services in order to bring them to legal framework and we are ready and open for cooperation. Thank you for your discussion, and I will stay till the expert discussion at the very end. Thank you very much. We were happy to hear that you eager to participate in drafting of regulatory documents about conditions, how to better ensure fire safety in the rehabilitation centers, and we are ready to bring together participants of this panel and organize consultation, and by the end of this year to produce necessary documents. And one more question, please. I believe that we will meet at the panel discussion. And it's my pleasure to invite to the microphone Oleg Alishevsky, the head of the therapeutic program of Narcological Department number 5 and Kyiv City Narcological Clinical Hospital, Sociotherapy. I would like to introduce our rehabilitation program, which has been existing for 20 years in the Narcological Department number 5, and describe our principles of work with patients. Oleg, we cannot hear you properly. May you shift to another internet connection. It's much better. At least I can hear you. As I mentioned, we would like to share our experience of rehabilitation that we offer to the drug addicts. I personally participated in development of those methods, which I am ready to present to you today. Rehabilitation in broad sense means union of social, economic, medical, professional, psychological, and other measures offered by state and NGO, state organizations, NGOs, aimed at the revival of the capacities of a person which were broken in result of this or that reason. And according to the WHO classification, we offer medical rehabilitation. During the years of our work, during that 20 years, we had established 4 major principles on which rehabilitation programs are based. First is establishing working cooperation between the client and the experts, and in result of this working cooperation should be signing of therapeutical and social agreement between the service providers and the patient. The next principle is the multiplicity of efforts and measures. Rehabilitation requires multiple efforts from family, friends, colleagues, and the patient herself. Very close involvement of the family is needed. The third principle is about unity of psychosocial and biological methods of impact. This requires psychological, social, and pathophysiological essence of the drug addiction. And the fourth principle is about the specificities of the models of drug addiction and drug conception, and coordination of the methods of treatment with these specificities. The biopsychosocial concept takes into account the use of drugs, the nature of addiction, perceive this as a way of exploration of the world, and we believe that this is psychosocial experience, and we distinguish between the experience in the individual development and up to the formation of addiction. So the preconditions are there are 4 preconditions for the addictions. Biopsychosocial model includes all the aspects of this problem, physical, psychological, and socio-cultural aspects. Since we are a treatment facility, we are capable to act at the medical level, at the biological level, and after our biological work, we can accompany them, send them to the narcological department number 5, where we can see interrelated impact of the environment, genetics, and treatment. biopsychosocial approach includes the interview and according to international practice, and this protocol allows to decide about the intensity of addiction and survey the status of the patient, and thus develop the individual method of treatment, individual procedure of treatment. Further on, this individual plan becomes the reference point to which we address at each stage of treatment to correct and review it. About methodological fundamentals of the rehabilitation program. The paradigm is based on full rejection from psychoactive drugs, and we use scientifically grounded forms and methods of rehabilitation, and the overall goal is to reach fundamental change in the lifestyle of a patient. So major tasks, conscious abstination from drugs use, improvement of psycho-emotional situation, and improvements in social functions of a patient. As to the conscious abstination from narcotic drugs, we explain the role and place of drugs in the life of patients. We train them to control their behavior as to the consumption, and then provide recommendations. Psycho-emotional status. We train to distinguish emotions and teach emotional self-regulation. We increase positive emotional experience, and we train and new strategies for self-regulation, and then we train our patients to prevent any repeated use of drugs. The technology of the rehabilitation, technique of the rehabilitation work, the technique used in the program are based on a Branda approach, on Prohaska and DiClemente models of changes. Now connection is disrupted, sorry. Connection is disrupted. I hope Oleg will be back as soon as possible. Unfortunately, Oleg has improper internet connection. We will try to connect Oleg for the panel discussion, and again, unfortunately, he was unable to finish his presentation, but hopefully he will join us later and finish his presentation. Now I would like to give the floor to Ms. Svetlana Rumyantseva, expert of the Center for Mental Health and Monitoring of Drugs and Alcohol. She will present challenges associated with new psychoactive substances, and she will address the problematic issues. Thank you for inviting me to the conference. The issue that you have raised during this conference would improve the situation. As for my presentation. Next slide. We have seen appearance in Ukrainian market of new psychoactive substances, and during the last 20 years we have added a lot of new substances to the list of psychoactive drugs. But the proper response it could not does not exist, because this provides for multiple reaction, not only putting into the list but also ability to track the circulation of the substance, to find the victims, to approve the protocols how patients could be treated from abuse of those substances. And as of today, we have very limited regulations upon which we may base our actions. The law in Ukraine on drugs, psychoactive substances and precursors allows law enforcement agencies to expropriate such substances, but it does not allow to understand the sort of substance. Then medical staff which arrives to the site know how to deliver assistance, but they cannot take any further measures. Also, some treatment is possible when there is overdose, and some users who use the substances or abuse the substances, they presume that they use a pure substance while they use a dangerous mixture of them. Also, the residuals of those substances may get into waters, etc. And tackling of all those problem issues might provide at least some solution to this problem. In 2019, the Ministry of Health had published its order number 770, and this was the order about procedure, how the substances could be put into the special list, but as of now we do not have an examples of classification of some substances as analogs of dangerous drugs is done very rare in Ukraine. In European countries, this mechanism is not the case. This technology is not used. That is, voting for the substance is not undertaken. We have several labs which are competent to establish, to determine the chemical composition of the drug substance. And then a special opinion should be produced whether this is a psychoactive drug or not. That is, we have such experts, and only if these experts produce an opinion that this is a substance that could be classified as drug substance, or it should be called the analog of existent psychoactive drug. Looking at the international experience, we had found that
in other countries of the world, there are data of the law enforcement bodies that provide information. Then the information is received from the internet space as to manufacturing, the routes of supply, markets, and other factors that concern psychoactive substances, and also information of the competent international bodies about the proven and identified facts of new psychoactive substances, the methods of identification of new substances are methods of chemical analysis and also comparison with the standards of 33 countries and online databases, which exist in 19 countries. The international experience, the countries where many new substances were appearing, they were using different types of mechanisms. Lithuania, for example, they introduced amendments to the list of the drugs, narcotic substances, and they mentioned that this list includes the analogs of all known substances which were introduced into this list. And the reaction in these countries is very quick, because when sending the substance to the laboratory, they immediately get an opinion that the substance has a chemical composition of the one which was included into the list already. What has been done? We suggested similar approach. We suggested to introduce amendments into Resolution 770, and we suggest to introduce amendments to the order of the Ministry of Health number 715, which defines the order of recognizing the analogs, and we identified the responsibility of the agencies and institutions which are to conduct such work. We suggested also to introduce amendments into Order 188 so that the analogs which are included into the list, the amounts will be indicated the same as the amounts of the substance which is already included into the list. What has been done? As of today, we have drafted the order as to systemic gathering of information as to new psychoactive substances. We are planning once every 3 months, so once half a year, to send the questions which will help us to examine whether it's feasible to include the substance into the list or into the register of analogs. Also, together with the international charity organizations, we're working on the draft law on receiving objective data from entertainment facilities. And again, that refers to the substances which are to be included either into the list or the register of analogs. There are several forensic laboratories, and we're checking whether they have standard samples so that they can quickly identify substances, and in the result of generalization, we will be talking about having the single approach in the state to the identification. We have already developed the amendments to the order number 715. Some of the authorities agree without any comments, and some write some comments which are to be taken into account. And as of today, Sergei Rudy mentioned that we initiated with the support of the UNODC, the creation of organizational working group, which will be translating and implementing the international protocol concerning treatment of people who abuse or consume new psychoactive substances. Thank you, Svetlana, you've done a lot. We'll talk about you as to what is to be done during the panel discussion, what needs to be done in the rehabilitation centers. Now we would like to invite our next speaker, and that is Irina Skripka, the lawyer, and she will tell us about legislative obstacles to the functioning of social rehabilitation centers. Irina Skripka and her colleague helped to draft the agenda for this block. So, Irina. Good afternoon. I'm happy to have this chance to speak at this conference and to discuss all these issues related to social rehabilitation, which it is very important to discuss all these issues. Yesterday, the Deputy Minister of Social Policy was speaking here, and it was mentioned that in our country there are just 3 centers of providing social rehabilitation, the Donetsk, Khmelnytskyi, Nikolaevsk, and Odessa regions, and there are only 74 beds where people can have social rehabilitation. During the whole last year, only 74 persons got rehabilitation, but 1,500 people got an opportunity to get rehabilitation in the centers. We are saying that there are hundreds of thousands of people who require the social rehabilitation, And this small percentage of people that could be covered by the state centers does not address the problem existing in the society. As to obstacles for functioning of social rehabilitation centers, which private businessmen could open, because they can improve the situation with the social rehabilitation of people who abuse of psychoactive substances. The information of social policy yesterday mentioned that the register has 32 subjects of entrepreneurial activity that provide services in the sphere of social rehabilitation. In Ukraine, we have 70 of such centers. At the same time, we need more of such centers because we need to cover all people who require social rehabilitation. At present, the legislation does not describe the activity of social centers. But what we hear from the state that we need to develop new standards. The declarations are to be submitted, that licenses are to be received for this type of activity. All that is over-regulated. The state is trying to put the responsibility to private business. The existing 3 social rehabilitation centers, that's not enough at all for private business to be able to come to the sphere of social rehabilitation. For that, the legislation should be drafted which will satisfy both the state and the representatives of businesses that will render these social services. So we need to develop such mechanisms, such legislation which would help private business to invest into such centers. The state should differentiate and clearly state what should be the requirements to these centers. And these requirements should again satisfy both the state and the representatives of business. So the social initiatives developed by the Ministry of Social Policy, they suggest that if people are treated in the centers of social rehabilitation, that they suggest that the centers should get a license for such type of activities. But as it has been mentioned, the regulations or bylaws should be adopted which would clearly regulate these activities and will allow the centers of social rehabilitation to operate properly. As to fire safety requirements, yeah, that's another quite important issue, but if the inspector of the State Service of Emergency Situations comes to the facility and they enumerate like 50 types of violations and many violations of the norms. An expert in fire safety spoke here, and it was mentioned that some minimum norms are to be observed. And because people who work in the Ministry of Emergency Situation, they agreed to give some advice, but the inspector, when the inspector comes to the facility to inspect, they don't want to understand the situation. They just enumerate all possible violations, even small ones. That is why the work of need to draft the norms which will be applied. And these should be the norms for all the spheres of functioning of these centers, which could ensure the rights of people who will go to get treatment in these centers. And also the interests of all stakeholders are to be taken into account. Besides, I'd like to draw your attention to the fact and that is what Igor Shiglov was talking about. He mentioned that some order of the Ministry of Social Policy, National Police, the Office of the General Prosecutor should be issued, because the interference of the law enforcement bodies into activities of such centers are not really substantiated. Usually people violate the criminal criminal proceedings are violated, and people are kept in detention facilities for more than 1 month. Then the cases are transferred to the court, and those people who wrote that they were tortured and so on, they don't come to the court. And in the result, we receive not a sentence, but nothing. Because at the stage of pre-investigatory inspection, you can check whether people in this rehabilitation center are really tortured, what conditions are in this center, because the centers that work properly, they take papers from people who come to this center. Very often they record a video when the person says that the person voluntarily agrees to stay in such a facility. And really the criminals are to be identified, but they shouldn't create obstacles to the work of the fair real rehabilitation centers. Mr. Kuleba mentioned that we have many teenagers who not just drink alcohol, but every 5th teenager who was interviewed, and these are 20% of teenagers who consume drugs. And the centers of private business, the representatives of rehabilitation centers could conduct awareness campaigns. And they can make certain films, they can invite those who are in rehabilitation centers to different conferences so that they explain to teenagers what are the negative consequences of drug and alcohol addiction. And I also would like to draw your attention to the fact that the centers of social rehabilitation, they have developed a certain methodology which is effective and which helps in treatment of drug addicts. And that is why that is quite a big topic, which wasn't just discussed by this conference, but that is the problem existing in the state as to social rehabilitation of drug addicts. there's a lot of work ahead. And I would like to address the representatives of the state bodies and say that all aspects of this activity are to be taken into account. And the representatives of private business should have the opportunity to start their activity in this sphere of social rehabilitation. Then we will cope with this problem much quicker. And because at present, the statistical data shows how many people commit crimes and when they are consuming drugs, whether the programs that exist help people not to go back to drug addiction.
I would like to draw your attention to the following fact: strengthening control over rehabilitation centers from on this side of state institutions would not promote more efficient work of such institutions. In order to do this, a strong cooperation should be established between the state and those private businesses who are eager to carry out this work, and we need, as a state, set clear rules of the game, as I mentioned, and all that is aimed at prevention of violation of the rights of patients, and on the other hand, we should be able to ensure these services of social rehabilitation. Thank you for your attention. Irina, may I ask you several questions? Although I'm not an expert, could you explain what is the system of taxation for the private rehabilitation centers? What taxes are paid by the rehabilitation centers? It depends on how the rehabilitation center is registered. If this is a physical entity, private entrepreneur, then such person pays 5% of income, then it pays a single social contribution and also the payroll tax, and if this is a limited liability company, then again they are subject to all the corporate income tax or company tax that has to be paid by a private company, and also by the payroll tax and all social contributions for each employees. So my question was that there is no special privilege to the providers of these services. Yes, no privileges. So this is true about medical institutions. Yes, the same is true except state medical institutions. who have to get licenses, and now they are subject to separate piece of legislation, but all other medical treatment centers should be registered as either private or as either private entrepreneurs or legal entities, limited liability companies. Then could you explain how it is possible to regulate positively the treatment which is offered to minors? We all understand that treatment of minors is a painful issue. All the minors could be brought to treatment only upon request of their caretakers or parents, and in the future we should be able to entrust psychiatrists who discovered some disorders or need for medical treatment, apply to court, and upon court decision, such a person should be directed to the treatment facility. And thus the state will become able to supervise this process, but this is a remote future, so to say. So when it comes to minors, their parents or caretakers can bring them to the medical treatment facilities. Thank you for your presentation. And now I would like to invite to the microphone Vladislav Kostyuchenko, Recovery Ltd. This is one of the biggest Recovery LLC, head of the division, Renaissance Association, specificities of social rehabilitation. We, as far as I understand, you promote the principle of open rehabilitation. Yes, thank you for this conference. It's an honor for me to participate in it. I'm happy to introduce the International Renaissance Association. I would describe the principle of the open department, open institution, principles of work. I would start from the description. What does the open type department means? Quite often people do not understand what does the open type rehabilitation center means. Some people believe that this is a fully voluntary institution where people can come and they are very willing to do something, and they persistently follow this course. Or alternatively, some people believe that this is low efficient, very weak structure, unable to reach tangible results. In reality, when people come to us, we reject 9 candidates out of 10. Why we do this? Because the drug addicts in many cases are not eager to take treatment. But doing that, we keep in mind one nuance. That's true that sometimes people come and ask for help, but we from the very beginning look at the motivation. Quite often people come to rehabilitation because the reasons might be multiple, trying to hide from creditors, an attempt to escape from some other hard circumstances, or other life problems, but only those who sincerely are keen to get rid of the problem, these are our patients. Then motivation to treatment is also important. Negation of the problem is one of the symptoms of this disorder or addiction. Quite often patients arrive and they believe that they would need just a couple of the group sessions to get rid of addiction. They are unable to assess their potential and capacities adequately. At the very beginning, we take enormous effort to retain people in treatment. We work with patients, with parents. Some parents are unable to imagine the degree of addiction and the meaning and the suffering of addiction. And yesterday it was mentioned that 50% of people in our country cannot imagine the addiction problems, and quite often people are poorly informed, and sometimes we are unable to help to the patients. Some people undertake detoxification course and believe that they know what rehabilitation is. Quite often drug addicts are victims of criminals, of fraudulent activities, and quite often people are not sure that they want to try rehabilitation, and they are very cautious about it. Sorry, I've deviated from my direct subject. Also, many speakers mentioned the issue of minors. Quite recently, I got a call from a woman who requested for a help to her 14 years old son. and unfortunately, she immediately heard no from me because we do not deal with minors in our everyday practice. First of all, to do this, we need to have the psychologists who are certified for the work with children. We do not have such specialists. You cannot just take this minor and provide the non-professional service to him, to her. Of course, that woman was very much disappointed and aggressively attacked me, asking that how I wait for 4 years to get help for my son. What does it mean? Open type rehabilitation. We work with motivations. The addicts come to us due to different circumstances, and the first period of our help is based on the restoration of motivation. And only half of cases become successful at this stage. At this very stage, at this primary stage, half of the cases which are successful increase the motivation of an addict. At this very stage, his close surrounding, like family, relatives, friends, should make pressure upon him, upon her, and depending on the final result, whether this is successful or not, patients either decide to stay with us or to quit the treatment. This is extremely important moment because except this level of persuasion, attempts to convince people, and based on fully voluntary basis, we do not have any other requirements. And sometimes even accidentally we might hear threats from our patients that they would say that they were detained here forcibly. We in Ukraine, it is possible to find a marketplace and to order a portion of drugs, and this portion would be delivered anywhere. And when patients can retain their mobile phones with them, they could easily find the dose. But our practice proves that the parents who call continuously can make the biggest problem. Last week, one mother had called to me, please send to me 1,000 hryvnia. for water, etc. And I had to organize a special meeting with this guy and explain to him that he should not require money from her. Next day, his mother called to me and said, perhaps he feels offended. Maybe I should call him and apologize. So this is an absurd situation. What are the ways of influence do we have? Partially, this is our methodology. Partially, we do not have other way out than to use these methods. This is professional work with relatives and family. The second, very soft work with the addiction. This is called the guest day, when any addict may come to us and stay with us during one day to observe how this rehabilitation process takes place. And in this situation, potential patients are able to assess the situation. Up to 2/3 of guests who come to visit us during guest days, they make decision to stay with us. And the next
хочу немножечко объяснить, что такие моменты, они...
Social conditions to some extent, all those conveniences, they counteract to the idea of rehabilitation. In order to ensure rehabilitation, some re-evaluation of values should happen, and when the addicts find themselves in a situation when instead of your individual room, you find yourselves in a room with, in a bedroom with 4 children, in 4 people, sorry, in a dormitory with 4 people, and this forces you to reevaluate your life. And while these comfortable conditions allow you to step back from this reevaluation, and due to this open type approach to our department, we see successful rehabilitation only in 50% of cases. Then when we say that we offer individual approach, different patients understand this in different ways. And sometimes they perceive this individual approach as excess comfort and supplies in this institution. And due to these comfortable conditions, some patients find that they are oversupplied by their parents, while others face a situation that their family cannot provide them with excessive comfort, and they have to be satisfied with what they have. So this again brings us to the fact that we drastically need support from the regulatory framework. Currently, there is a big lack in regulations. I am very eager to deliver services to these people. I believe this is socially very important, but without regulatory framework, I won't be able to do this properly. And eventually, I would like to say that this conference is extremely interesting, extremely important. It has brought together representatives from different areas which contribute to the problem, and doing work together without excessive criticism, we would be able to find the ways out from this difficult situation. The way of restrictive social response is a proper way for our joint action. If you're interested in the topic which I described, if you are interested in our product, you are interested to see how it all happens, I'm open to your criticism. I would like to know your opinion. Thank you for your attention, and I wish you all the best. Thank you. Ladislav, I have a question to you. It looks like you are a big network. How do you train your staff? Because as far as I know, in Ukraine, we have international trainers, but I assume that we have a huge lack of working staff for such facilities as yours. That's a good question. I may answer based on our staff pool, so to say. Of course, we cannot train the narcologist or psychiatrist, the psychologists. Again, these are types of experts whom we invite. Message experts, these are experts, while the lower experts like support staff, these are our former patients who were specially trained upon treatment, and having got all those multiple experiences, they become qualified professionals. They are very much familiar with the concept. They are practitioners knowing how to respond to tough situations, and then we encourage them to gain psychologists education, and they become rather qualified practical trainers.
And the open type facilities, that means that there should be a close contact of the patient with relatives. And what can we do with mothers, wives, husbands? They provoke this type of communication. They attack the center. In the middle of my presentation, I talked about that. Mothers, wives, they call, you were talking about phone calls, but I'm talking about physical visits. Well, we don't have that thing. There's a huge hyper care. But when we take the patient, we explain it, we leave the right to cancel or to make void the agreement if there is inadequate behavior by the patients or by the relatives. We organize special groups for parents. We have special consultations for parents. Then there's family therapy where the psychologist becomes like a referee, and he is like a referee between the patient and relative. There are cases when we have to annul the agreements because parents do not understand what's happening. They don't want to listen to us. They believe once they paid for rehabilitation of their child, they can do whatever they want. They know better what the child needs, but still they come to us. These things happen as well, but usually these are people who just do not know what to do, and many of them, after 2-3 consultations, they're ready to cooperate. They're ready to independently study some methodology. These are not many cases, but still, the parents would have at least some competences. The worst cases are mothers and wives. Thank you. We'll meet you again at the panel discussion, but now I would like to invite the Tatiana Lebedь, the director of the Association of Women who are drug addicts, which is named Vonna, her. She has something to tell us about stigma, discrimination. Tatiana, can you hear?
Доброго дня.
Good afternoon. One second, we hear you.
Дуже дякую вам за
Thank you very much for inviting. Thank you that we will hear the voice of the community today. I'll be talking on behalf of the representatives of the community of people living with drug addiction in Ukraine. Could you please show my first slide?
Наші представники та представниці входять до
Our representatives are members of the
Ми є ініціаторами формування
we are initiators of forming the strategy on that on the photograph you see our representative who's making presentation in the Committee on Social Rights. After that presentation, Ukraine received some recommendations, which you can see, and all the positions which will be explained, which we hear. It's not just my opinion, not just what I think. It's after the resolutions were signed, thousands of representatives of the community of people who live with drug addiction in Ukraine. I'd like to mention that these women, they suffer from the stigma and discrimination. The Charity Foundation Hope and Trust made a survey, and we received such results. 36% of women who are living with drug addiction experienced a refusal in providing medical assistance because of drug addiction. Only 14% of pregnant such women received absolutely satisfactory services, and only 4% of women living with drug addiction received assistance from national police when they would come to them. You see the links to the surveys and the case in Dnipro in March this year. The next slide, if you may. Every third drug addict is a woman, but in the programs of treatment, only a woman is only 1/5. And that is another issue, the high threshold, all the factors which do not allow a woman to go to treatment program. There was a lockdown now, and because of that, it was very difficult for women as well. And that is the slide as it is. That's quite a sensitive topic for us. But here you need to have also quite a comprehensive approach. The next slide. This association, WONA, is non-for-profit organization. The leaders of this organization are women, and our mission is we women who lived with drug addiction, and we got united for the dignant life. The women who are part of our organization could be women who have had many years of remission. All those present understand that this is a disease, and you can be only in the condition, in remission. The most effective approach to providing assistance to people who live with drug addiction is a format peer-to-peer, equal to equal. In all the regions of Ukraine, we have our representatives. These are regional coordinators and para-lawyers, and they assist women to address the issues that they are facing, because the stigma is so big that just going a visit to the doctor for some women is a problem. Also, disclosure of the status and many other things in small towns and villages. That is a big problem. And all the surveys talk about that. The next slide. Here you see almost all the organizations with whom we cooperate in order to satisfy all the interests of the community. This is the Center of Public Health, Alliance of Public Health, also Hope and Trust, the Charity Fund, also the project RIA and REACT, and the Charity Foundation of people who are drug addicts, the Office of the Ombudsman, partnership with organizations who are involved into counteracting home and gender violence. Also, there is organization Volna Wave, which has also the representatives, and many talk about our activity, about our mission. There are cases when they are invited for some consultations because of some patients. The next slide. Here are the links to the stories of women who had rehabilitation. We wanted to show one case which is negative, one which is positive, but we were taking just the quotations from women. I experienced awful centers. I was tied up to bed. Myself, I also was in some rehabilitation centers. I wasn't very lucky with these rehabilitation centers. There are very good ones, but I wasn't lucky to be in good ones. And you can see the story following this link and the story of a couple where they had a little child. Not all the rehabilitation centers can take people, women with children. That also means that we need standards based on human rights, first of all, because once there are no rights, there could be no rehabilitation. Down there is a survey on the situation with rehabilitation in Ukraine today. I recommend you to go there. Please read it. It's very interesting. We are looking at rehabilitation as an important component of harm reduction. It's very important. It's as important as the access to sterile injection tools, tests and treatment of HIV, the program of substitution therapy, and the prevention of overdosing and non-discriminatory approach to drug consumers, users. The principles of assistance to addicts, the accessibility and voluntary principle is of importance. Following legal and ethical norms in course of treatment. The treatment should be based on scientific approaches. The needs of specific groups like women who live with addiction should be taken into account. Also, there should be the access to medical assistance, integrated tactics, services, programs, and approaches which are comprehensive and of high quality should be implemented within the state guaranteed services. During the rehabilitation, the gender aspect is to be taken into account because men and women are different, they have different needs in rehabilitation as well, because rehabilitation has no gender. Very often pregnant women who use opioids, they are recommended to refuse from use of opioids, even though this could lead to
це взагалі
early
такі непросте питання, і не тільки відживання на
birth,
а й
and
відсутність
that there were cases, even with substitution therapy, when the woman got an advice to refuse from using such medicine, and that could provoke a big problem. There are very few centers that can take a woman with a child. Very often, women, and not just women, need further assistance in legal issues, in employment, maybe putting to a shelter, because during the drug use, all communications could be lost, just like documents, and the person has to be somewhere. Next slide. Recommendations of people who live with drug addiction in Ukraine, resolutions of the forum of the 2020, and the resolution of the forum of people who live with drug addiction in Ukraine of 2020. We need the single standards and approaches to rehabilitation that would be adopted at the state level. The client should have the right of choice among the programs of harm reduction. Also, the agencies should help in employment and getting medical and social assistance. After completion of rehabilitation, the person should have information about the activity of organizations, as well as legal support and support of social workers. For us, it is very important that now the state is introducing standards of quality rehabilitation. We as organizations of civil society that represent the interests of people living with addiction in Ukraine, especially organizations Vona and Volna, will be supporting progressive approaches and will create an effective system of addressing clients to guaranteed services, which would correspond to which would ensure the human rights. Also, we as representatives of community, we insist that there should be the full spectrum of services guaranteed by the state, the program of prevention, the programs of harm reduction, programs of substitution therapy, rehabilitation in the form of services, medical, psychological, and social. And also there are commitments taken by our state at the international level, decriminalization of drug addicts, following human rights, and also accessibility and voluntary principle in getting treatment. Thank you. Myself and our organization are open, and I will answer all the questions if needed. Thank you, Tatiana. It was very interesting. I've learned a lot from you. I'm not really the representative of this sphere. Tell me, please, what are the organizations you cooperate with when we are talking about children or other categories? Maybe you should explain that besides the standards that require scientific practices, maybe some simple things like brochures, education, where to go. Maybe we need to get these programs integrated right now. We are ready to help you, but just introduce us to those people who know exactly what's needed. Okay, thank you for your question. We will send you the list of organizations who are doing that, and what you are talking about, that's very important. Because myself, for example, many people were saying correct things, but I, for example, do not understand. I am a mother, I have a son who's 9 years old, And very often I think that the time will come, and at school or further at the institute, he will face the problem when someone will come and say, let's use it, let's try it, I'm so cool, are you afraid? And from my own experience, I know that I was brought up in a very good family. I had everything I needed. I studied at the Institute. I was in sports. Everything was great. But the moment comes when something happens, and then the child should be ready. And it's not about the will. Oleg, if I'm not mistaken, maybe not Oleg, said, yes, these are inborn things, but still we need to tell people, children, more about love. Just tell them more. I love you so much. Don't, if anything happens, you will learn about it earlier and you will have more time to do something. Because I was hiding that for 2 years. I was addicted. I had 10 different types of tone creams, and I was covering, like makeup, covering my hands. My parents could not believe it. They were saying that it's not a disease, it's about the will, it's about some whim. But the parents someone told them that that's a big problem, but the parents wouldn't believe it. But when successful men and women come on cars and they would say, and that was in my life, and some fashionable women and men came to us and they were talking to us teenagers and they were saying, we can use the drugs, it was awful. Half of our friends died and half of them are in prison, children, that's so bad. Now there's internet and other things. No, don't consume. You look at that and you think, okay, they coped, why I cannot cope? They work in this sphere, they get money for that, maybe I will cope with that. It's not just opinion of someone. We need to have a comprehensive approach. There are many specialists. There are these days show that there are people, and we know that there are such people. I am not ready to answer the question what needs to be done. There's no one answer. Yes, you need to love a child, to accept everything, and then you will have time for some manure to at least do something. Okay, thank you. We'll meet in 20-30 minutes at a panel discussion. And now I would like to introduce our next and final speaker of this conference. But before I do that, I would like to remind our viewers that you can send your thesis and we will we will publish the presentations of all the speakers and also we'll put videos, download the videos and also the presentations of all the speakers. We will give your questions to speakers, send your questions to speakers if you have them. We will try to do it so that the conference is not just an event that we had, but so that it becomes the beginning of some media campaign which will allow us, together with the state bodies.
Пане Андрій Тищенко, будь ласка, ви мене чуєте? Скажіть мені щось, щоб я вас також почула.
Так, я вас чую.
Ви чуєте мене? Так, пане Андрію, будь ласка.
Итак, я хочу представить нашего последнего.
I would like to introduce our speaker, Andrei Tищенко, who's the senior bishop of the Association of Ukrainian Christian Churches. new generation. Андрій, the floor is yours.
Good afternoon. Thank you for this opportunity to address to the audience. I've been listening to Tatiana's presentation, and I think that it's very good that there are people who represent the addicts. I do not have special skills how to work drugs and alcohol addiction. Some 25 years ago, I simply showed hospitality, offered my hospitality to the drug addicts and alcohol addicts, and invited them to my home. And since that time, I started doing that, and the whole movement had developed. Although these people perhaps are not perfect, nobody's perfect, but today there are around 7,000 of people who restored their lives after drug addiction and became members of the Protestant churches. That's why I say that I can follow up their life after rehabilitation. So at the very beginning, people become subject of influence of other people in bad environment. They start new life, and all the relationships are built around the drugs. Of course, when you are surrounded by people who have only one strive to use drugs or alcohol in any possible way, it is extremely difficult to get rid of this habit. During my life, I observed many tragic lives, lost children, lost parents. There's a terrible tragedies happening at the level of drug addicts. Sometimes we are shown documentaries from developed countries that addicts could be brought to special centers in very civilized way, etc. And in our country, unfortunately, 70% of convicted criminals, they were convicted being drug addicts or drug abusers because they committed crimes in very specific situation, and under these circumstances, even those addicts who come across a fancy to leave this environment, they face extreme difficulties. Keeping in mind my own experience when I offered my hospitality to one drug addict. And gradually he changed fully the surrounding. I represent Protestant churches. These are usually associations or unions of people who are united with joint goals, with joint objectives. I definitely can say that if addicts are able to change the environment, to change the residence place, even the city, etc., even when they're able to break this full rigid structure, in many cases, in the majority of cases, it becomes possible to take people out of this environment. When the addicts find themselves in the environment of rehabilitation center, having positive example of other people who managed to get rid of the addiction, and with the support of these people, and when an addict can observe the fellow mates who are ready to reject from food, to start fast, to pray for him, they immediately feel this support, and they become more willing to reject from addiction. And of course, there are more problems with exceptional emotions which are manifested by these people, and of course this gives rise to conflicts, and sometimes due to these emotions, addicts even change their decision to get rid of the addiction. Some 3 years ago, we had a meeting with Minister Abakov, and he understood that when you try to help such a person who are first invited to the rehabilitation center, and then they, under the impact of emotions, they decide to quit, then they take adverse decision and decide to come back. So to prevent this complications, so to say, we came to an agreement that in such situations we would invite police officers who arrive in uniform and convince such addicts who stay in the rehabilitation center that without treatment, without rehabilitation, their life would come to the end, and some rehabilitation centers established those sorts of cooperation, but gradually, due to the big load put over police officers, this cooperation had finished. So my message is as follows: I'm surrounded with the past drug addicts who have been treated and got rid of their addiction some 25, 20, 10, 15 years ago. And I had an experience when drug addicts quit from their habitual surrounding in the Dnipro city, left to Lviv, found a new church environment that they joined the church, and even without treatment managed to get rid of the addiction. You mentioned about adults who apply for your help. What happens to the minors who come to you with a request to help them? This is extremely difficult. It is much easier to work with of adults, and minors remain a huge problem. Of course, we try not to deal with them because it is extremely difficult. Quite recently, one of the detention facilities directed to us several minors, and they managed to finish rehabilitation. But generally, it is a very complicated issue. We do not have good cooperation with the law enforcement agencies to ensure that we would not have problems with the minors. We have a lot of social organizations who want to help people, and they are eager to deal with the minors. I believe that these are not isolated issues, and the biggest issue for this country is that this is interagency problem which exists in the air. I mean, how to tackle with the minors, minor addicts, and dear friends, we have finished all the reports, and we need some time to connect all the speakers, and we encourage you to participate in discussion, or you may ask questions and participate in discussion. So please give us several minutes for connection.
Відеокамери.
Good afternoon once again. Some of you we met today, some of you participated yesterday, and very welcome to our discussion panel. And as far as I understand, this is the first event in the industry where all of us can discuss the issues very openly, without a interruption from the side of government officials. So I request for your trust and openness, and I suggest to discuss today 6 questions, and I encourage you to answer the questions which you like, and if you want to answer the question, then please raise your hand and we will understand. The first question, the existing standard of rehabilitation, which was passed by the Ministry of Social Policy last year, and which makes rehabilitation centers very unhappy. Why it is inappropriate, and what should be changed to satisfy the rehabilitation centers?
I'm looking at Vladislav, and I believe that he's got the map of Ukraine in his background, and he's ready to share his opinion about standards that exist. Thank you. I am not a legislative drafter, and it's difficult for me to criticize. There are many nuances well, we can talk about certain things which are obvious, but the conference showed that not everything is so simple, so easy. All these issues we are discussing, we've been discussing it for several years already, and it's difficult for me to criticize. We all are working in a different format, and to say that that is something that that I agree with, well, I maybe disagree with things that other people agree with. Igor Shcheglov, what can you share? In the beginning, I would like to say we talked to the Ministry of Social Policy, and we were saying there should be the standard for social psychological rehabilitation. There are many centers, and we wanted to describe what's the difference. We suggested some norms. The Ministry of Social Policy, they wrote the standard is described quite well, but there are certain details how to get it integrated into the society. Now, the different organizations, they do not understand why should they become, why should they get registered there. If they are in the register, that will mean that there will be 28 inspections, especially after this accident in Kharkiv. And we are not against doing it 10 times even, but in the result, there will be 20 inspections. Or do we need this standard? Do we need these centers? And there are many other things. When the social services, they don't know what to do. our people in all the regions, they came to social service and they said that we want to provide social services, but there's no mechanism how to become part of it. There's some social standard, but how to enter it? They say, okay, write the application. We say, okay, we will write the application, but we want to really have all these standards implemented properly. But then they say, we do not know, we do not understand. And the second thing I mentioned, if it's in the result of 20 inspections, then many are not ready. If it's about some transparency, I tell everyone, this is like the first step. But people are afraid because now all the centers, they're not protected. And that is the problem. All the leaders of such organizations, they are afraid. Irina, do you have anything to say? What's wrong with today's standards of rehabilitation? I would like to support Igor. Standard is described in general terms. We can say that these are not just that these are just general standards, and the standard refers to other regulations, but the regulations have not been finalized. The amendments were not introduced into them. And the question is how to get the social center registered and what are the requirements to these social centers. There's a standard, but for that standard, we need the legislative framework. And the legislative framework is to be amended first. So the work is going on, but as you know, Anna, you need to work long so that all the amendments are approved. The standard is just like a roadmap, and it describes the activities of rehabilitation centers in general, without referring to any other legislations. But these pieces of legislation have not been adopted yet. Do I understand you correctly that you believe we do not need to introduce any changes into the standard itself? We just need the documentations. Yes, that is the standard for all those who provide services in the sphere of rehabilitation. Alexander, what would you like to share? Igor mentioned, I will, today, for example, there was a meeting, a working group meeting, and that was about inspections related to rehabilitation centers. So being in the field, many people do not understand what's happening. If needed, we do that and we support that. But then when many inspections come, and these are the social services, the policemen who come, when 15 persons come to the rehabilitation center, those who are being treated there and those people are trying to be anonymous there, the situation will end up in the situations when people would leave rehabilitation centers. They didn't want anyone to see them. And this is one thing. And also I am in the activities, I am a lawyer. I will support my colleagues that the standards are good standards, but how they could be implemented without any regulatory acts, and irrespective of how many working groups we set up, these working groups disappearing in time. And I hope that this conference will at least start resolving or addressing this issue. We discussed this issue of inspections with different lawyers and with the representatives of some state bodies like police and emergency service. They inspect schools and kindergartens. Rehabilitation center is also in business, and they are rendering services which are to be inspected. The rules are to be clear, transparent, but we don't have a single business in Ukraine which wouldn't be inspected. That is our legislation. One thing we can do is we can help the state bodies or ourselves develop these rules, discuss these rules with the police, with the tax administration, with the emergency situations ministry. I agree that the raids to rehabilitation centers and to the facilities for elderly people, I agree that these some inspections which are extra, but basically such center is a business and it's like a school. It should be inspected. Sergey, you exactly know the international experience. How does it work in the world? I'm sure that rehabilitation centers and other developed centers, besides standards, have some inspections. It's different in different countries. These centers are inspected by more by professional community. Their activity is regulated by the professional community. The associations of doctors, rehabilitation doctors, these are all certified specialists, doctors or nurses. They cannot start activity without having a license. There are rehabilitation centers of different levels. There are based on religious organizations. There are some private initiatives of people who get united. And in any case, it's different. There's no one unified approach. There are different forms. They all work. All are trying to follow the rules. There are those who violate, but without that, that doesn't happen. But in our case, we need to drop the rules because I understand we don't have rules for the whole market. Rehabilitation is not a separate component. It's part of the process of continuum of treatment. And to take just one component, rehabilitation, and develop or draft rules just for that is not enough. We should not forget about other components of treatment. We need to remember about harm reduction, support, awareness campaigns, outpatient, inpatient treatment. That is what many speakers were talking about today, the stages of treatment. So I believe we need to find the possibility to discuss the system in general. Thank you.
Tatiana, it looks like you wanted to add. I do not work in rehabilitation area, but from the side of advocacy. Currently, we have such thing as forced rehabilitation when money are paid to private structures and people from rehabilitation service arrive, they simply forcibly take the addict, bring them to the institution, rehabilitation institution, and forcibly try to rehabilitate such a person. And this is actually very harmful. Once I observed that religious rehabilitation center, instead of actual rehabilitation, was preoccupied with construction of small cottages. Now I'm looking at a survey that 65% of women in rehabilitation centers experience physical violation, 40% of emotional violation, and 40% sexual experience sexual violence. And could you share this the survey with us? It is in my presentation, and I am listening to the discussion. It sounds like there is a normal situation, but the survey suggests that the situation is abnormal. Svetlana. During 3 years, I used to be a director of the rehabilitation center, and I tried to analyze our work, and I fully support Sergei and Irina Skripka. The standards for inspections should be minimal, and we have the standards of treatment, we have the standards for rehabilitation. As of today, we have the strategy, but we do not have requirements to the premises. And having such clear requirements, direct requirements, would allow us to understand what inspections are needed. That is all the external requirements to the premises, etc., to the rehabilitation facility should be minimized. Then about minors, we should minimize the possibility for minors to become drug addicts. So we should offer a roadmap to teachers, to caretakers, because rehabilitation, which we are discussing today, this is for addicts who were treated and who underwent treatment and who require rehabilitation to for reintegration into social environment. While for minors, we need more earlier rehabilitation. And for this, we should bring together parents, teachers, etc. And this work, this rehabilitation work could be carried out online, for example, not obligatory in a special premises. The next question to the experts. As of today, in Ukraine, we have a big number of non-users but addicts who do not have enough money for rehabilitation. As far as I understand, in this country, you cannot find free rehabilitation. Now my question to you. The addicts quite often cannot pay for rehabilitation financially. On the other hand, how can we ensure rehabilitation for aggressive addicts? What is your opinion, whether we should have a state order for the patients, that is to allocate money for the rehabilitation of patients with psychiatric disorders who cannot make this decision themselves? Perhaps I have asked very tough question. I believe that the state should order the services, those who render social service and get a fee for this service, they should be able to deliver the service to those people who need it and cannot pay. In this case, the state should pay for the service. I've been dealing with rehabilitation for 12 years and never had such a problem. We quite often we make decision to deliver the rehabilitation services because of moral considerations, simply trying to help, and of course we supporters of this idea that the government should be able to order such services. It's not a problem. The bigger problem is that we drastically need legislation in this area. As Sergei Rudey mentioned, that we do not have a team of experts who might offer professional upgrading of experts, etc. Ina, I wanted to add that currently the legislative drafts are being drafted, and these laws would make compulsory for the addicts who require treatment to start treatment and rehabilitation. Then we have draft laws which encourage offenders who committed offenses under the action of drugs to be liberated from responsibility based on the compulsory agreement to undergo treatment. And the free legal aid centers may be authorized to deliver these legal services with recommendation for further treatment and rehabilitation to those offenders who committed offenses for the first time under drug addiction, etc. And actually, this does not require the person to stay in this center for a year, for example. Sometimes up to 2 months is needed. And I believe that it is possible to allocate this modest amount of money for such treatment. And the Ministry of Social Policy might receive reports indicating that this or that addict has undergone treatment and is ready for rehabilitation, and this might become a part of the liberation from criminal responsibility for commitment of some minor criminal offenses, etc. The state should be interested that those persons who abuse psychiatric drugs, that they should be encouraged to take treatment and to take rehabilitation, because the situation of such addicts is very harmful for the lives of themselves and their relatives. Tatiana. I believe that there should be the state order and allocation of money for this. Of course, I believe that the Ministry of Social Policy and the Ministry of Healthcare perhaps should base the standards for such a state order on the human rights. Vladislav, whether the state order is needed. I agree with all the previous speakers. The state order will be very useful. Yesterday, during the conference, we have heard the case that if the state spends $1 for the treatment of drug addicts, saves $18 for more intensive treatment and in future. But the criteria, the requirements should be expressed very clearly, because we are private businesses, and here should be clear boundaries, so to say, because in Ukraine, if something is being established for the first time, it becomes limitless. That is, each rehabilitation center should be obliged to take up between 2 and 4 patients for rehabilitation at minimal cost, at minimal price, so to say, without any revenues for the institution. Because if you try to offer some margin for treatment, the state immediately would say that they have enough money. If you look on this from the assistance point of view, then we all are interested in delivery of help to people, that we look at this as a part of social activity. Alexander Переверзя. Back in 2019, 2020, we tried to develop a resource center, and we discussed the resource center with the Department of Social Policy, and we tried to get funding from local budget. This was a special program, the Clean City. Unfortunately, the project was never implemented, but the idea was great, and I believe that local territorial communities which now have their own budgets, and they are interested in making the atmosphere in the environment in the local community better, they would eagerly allocate money for this. But how to motivate the addicts to undergo this treatment and rehabilitation voluntary, even having the allocated money from the local budget? I believe that this could be resolved based only on the legislative base. I heard from many doctors that even partial compensation for the treatment and rehabilitation would drastically raise the number of those addicts who are ready to undergo treatment. My next question. Today we are discussing the rights of addicts, and we discuss these rights from the UN point of view. In reality, is quite everything is quite different. I'm a sister of an addict who had been rejected from treatment for 20 years, and only now when he has found the better center, he started thinking about rehabilitation. All that 20 years he had been creating problems to his family, etc. And the legislation prevents us from forced treatment, and he has all human rights. We cannot force such a person. But on the other hand, the family cannot coexist with such a person. 80% of centers accept patients who are brought forcibly to the centers. While in the past human rights had been violated quite often, but during the recent past, law enforcement closed several centers where human rights were extremely violated. But those centers where the human rights standards are observed, they continue their work. How do people arrive for treatment or rehabilitation? They should arrive fully voluntary, because without voluntary arrival, the treatment or rehabilitation is useless, and patients who come here, you cannot force a person. Any sort of treatment or rehabilitation could be only voluntary. It is inexistent because it is not required. It exists. But it is existent. It is existent by the moment when the national police uses this practice. But what to do with such a person? There is such a thing as a home violence. in this case, such an addict commits some crimes or criminal offenses at home. For example, a sort of violence against his partners, his parents, family members. He may steal things from home. Unfortunately, our legislation is very weak as to the home violence. So we may strengthen criminal responsibility for this violence and offer to such people alternative rehabilitation, that when such people face the alternative either to go to jail, either to be imprisoned, or to be accepted for rehabilitation. That is, alcohol addicts might be directed for treatment and rehabilitation. Those who do not will to be treated and rehabilitated, they should go to jail. So we should stimulate these people with the alternatives. Now, when we try to treat people forcefully, when you try to rehabilitate people forcefully, this brings no results. The other thing is that families and relatives are not protected against violence, and they drastically require this strong criminal legislation. So sanctions should be available. The criminal code sanctions now do not work because no mother would allow her son to go to prison for 2 years, for example. And of course, no relatives, no mothers are able to make this step. But any mother is able to understand that it can be an alternative, that is either to go to prison or to agree on voluntary treatment. And this is the only way out. A very good idea. Thank you.
I didn't think about home violence. Oleg, yes, I support what the previous speaker said. The situation today is that we need to act only within the existing legislation. If we get information about some forced putting a person into rehabilitation center, we need to first of all verify this information, and then the investigators will make a decision. But in any case, we saw the situation, as you said, while a person who is addicted until such person commits some offense, no one can put such a person anywhere. I agree with the initiatives as on the alternative punishment, which is rehabilitation basically. And in the international practices, they do have such things. When now we are amending the legislation, I think now we need to start working on this type of legislation. Thank you, Tatiana. Wanted to say something? You raised your hand twice or 3 times, right? You know what I wanted to say. There's an alternative to rehabilitation, that's substitutional therapy. That's a recognized method of treatment, but that's only if the addiction is to opioids, and the forced rehabilitation is not effective. No, I'm not suggesting. I ask what to do. Yes, I heard that. No, not you. That's not effective, not efficient, and then there is a higher risk of overdose or death. That is what I heard from the context, and that's when I raised my hand. Thank you. Sergey? Thank you. I mute and unmute all the time. I would like to say that the department on our department developed the standards of the prevention of addiction, and it's about primary, secondary prevention, the work with parents, with families, with schools, prenatal, postnatal prevention. That's a huge document. There's the second publication already. And that is one of the elements of how not to allow that the pool of people who use drugs is getting bigger. And again, I would like to draw your attention to the fact that rehabilitation is not something separate. It's just one of the elements of treatment. Vladislav. Thank you. I wanted to add what Igor was saying. I support him. Besides development of legislation, we need to have the commission, and this should be very serious commission. We know that in case if legislation has some gaps, it's not perfect, it hasn't been tested, it shouldn't happen, so that a person who got a sentence because of some hooliganism, and the imprisonment could be for 1 or 2 years, but he says, okay, I was under drugs, which these were all the drugs I was using, and then the person comes to us, he heard about drugs on TV, he says, I'm a drug addict, please treat me. And the state should pay for that, and we cannot understand what's happening. And all people around say the law isn't working. So all these nuances are to be taken into account, and the commission should be very, very serious. Which type of commission? The commission which will define whether the person is addictive or not. We're talking about the experts like psychiatrists and others. Yes, that's the team of people, so that we don't have the situation when they will be using this thing. Every person understands that rehabilitation is better than prison. I understand you so well. I just imagined how a person goes to the sentence says, take me, it's so good here. Svetlana. I just wanted to give you an example of how the Ministry of Social Policy finances the protection of rights of disabled people. I believe the same mechanism could be applied to our situation. They have the fund of the protection of disabled people, and it has the money from the state, from sponsors, grants. One thing is that they organize tenders who will, for example, be making a wheelchair, the state or a private company. And we don't need to invent a new bicycle. We need to follow the existing road. That's one thing. Second, people from law enforcement units are right saying that in our administrative and the criminal code, the when a person is drunk, that's related to, that could be used as one of the factors when the person could be offered to go to rehabilitation center. The person who's in this situation should be first diagnosed by the doctor and first have the medical rehabilitation, then social rehabilitation. There's a law on forensic medical expertise, but there are no methodologies. They're not on the website of the Ministry of Justice, but if we write it correctly, then this could be the group which will then send people to rehabilitation. We have pieces of the puzzle, we just need to put them together correctly. Victoria Mozgovaya, lawyer, is just sitting next to me and is putting it all down. Now let's move to the next question. I believe that the rehabilitation center is what in the world is called the social enterprise. That's the trend you can read about. It's something which is directed towards, targeted towards different parts of population who are in temporary discomfortable situations. If we look at that as at the social enterprise, which has these programs equal to equal, or there's some privileges in taxation, and then there should be some mandatory part which will be pro bono. Maybe such a program for rehabilitation centers could, first of all, take away the stigma. They will see absolutely new thing, like they will be perceived not as the prison, but as those who help. In Kiev, in Lviv, there are entities that teach, and I would like to offer it to you. Do you know anything about that? What do you believe, how this form could be accepted for the rehabilitation centers? Maybe I expressed it too complicated. Do international organizations talk anything about social entrepreneurship? Maybe they do, I don't know about social entrepreneurship. I know that in Ukraine, we have the experience of social entrepreneurship in organizations from Poltava. There's another national experience, and there's experience of support by regional or municipal councils. Yes, this is some new direction which is developed and supported in Ukraine. That's the form which is an open to the inspecting body, but they have some privileges and status and logic which are absolutely different. Okay, I believe that we will invite experts and we'll organize the round table for the representatives of the rehabilitation centers, and maybe this form will allow this sector to develop more comfortably, to find much better dialogue with the state bodies. Okay, and my last favorite question, minors, what do we do with them? Vladislav. I will repeat a little bit. I mentioned it already. It wasn't just me, but many speakers were saying that the work with minors requires specialists, experts. There should be certain software which is to be developed and whether some private entity will be doing it. It's a big question. There were different opinions about control inspection. Let's have inspections, but it shouldn't be eliminating some weak structures. Let's support them. Once we're talking about children's drug and alcohol addiction, there should be maximum control, there should be maximum transparent. And I believe that the only body that can do it correctly is the state, attracting specialists who have some experience in such work. And I believe we have enough of such people. Even if we look at the speakers who spoke today, everyone has some ideas and the experience of work with such people who were facing alcohol or drug addiction. Okay, thank you. Anyone else would have a different opinion? If I may, I raised my hand. In the world, there's such methodology which is called SBIR. It's a referral to treatment and brief interventions. And this technology is SBIR is applied to different levels of contact of a teenager with the system of medical service. This could be doctors, medical workers in schools, social workers, psychologists. And this is how we can enter the system. For screening, there are many screening tools. And in this methodology, they use very simple instrument, cage, 2 blocks of 4 questions. There are such methodologies, and they are to be implemented. With annual medical examination that could be not just the doctor, but the nurse could ask these questions. The policeman can ask questions from this cage template. There is a special instruction for policemen, 10 questions that would help define the problems. That's also part of SBIR. There is such a thing in the world, and we need to get adapted to our practices. We need to make them so that they are easy to use. Svetlana, did you want to say something? Yes. First thing I wanted to say, I would like to support Sergey and emphasize we wrote the strategy of and the indicator of quality in all 5 strategic targets is availability of standards. I can tell you that we practically have no standards, not in law enforcement bodies. In medicine, we have 1 standard. Social services in 2016, we believe that's a big breakthrough. That's a big problem. What I would like to suggest, let's take as a pilot project in Kiev, assess the situation of consumption of drugs if we analyze waters, sewage waters which come from schools. The lectures will give no results. If we take the water for analysis and we'll see what drug is there, then we will understand what's happening in this school or university. I cannot imagine how this could work. If you take a water and you conduct sociological survey, that's the standard of European Monitoring Center. They came up with the suggestion to do that in Ukraine. We wrote to Vodokanal. We wrote as the state, and they told us we are a private structure, pay us money for that, but it costs copics to do that analysis. It's not something that we invented. That's international standard. Sergey said, yes, yes, I've heard that. We'll include it into our draft, and we'll talk to Vodokanal from as a non-state-owned entity, Sergey. More than that, that is the regular practice of the European Monitoring Center. Once every 2 years, they conduct such a survey, and then the result of the analysis of sewage waters, they sometimes even discover some new psychoactive substances. And if this becomes the practice in Ukraine, that would be also very useful. How much will it cost? I believe if we take 1 to 18, we have to do it. Another remark. I believe that we will have the result and we'll get it quickly. All schools need it because before we started, we tried to start, we interviewed teachers and all teachers reacted to that positively. Alexander Periverzev. Okay. I would like colleagues to share my experience. I organized trainings at the level of Department of Education in Kharkiv. More than I did this training for more than 6,000 students in private dialogue. The teachers, the directors of schools, they all know who are problematic students. When I came, they were interested and they did some anonymous survey whether the students of the 9th or 10th class know whether they know anything about psychoactive substances, and 90% of them said yes, they know. That's scary. And quite recently, this year, a mother called me, 2 brothers, 9 and 11, and they are actively using for 1 year. The police and social services refused from that, and we have no right for that. How it happened, we don't know, but I understand that this is a topic which we have to discuss, and we need to launch some pilot projects in Kharkiv, in Lviv. I am ready to participate in that as much as I can. Dear friends, thank you. The time is over. Practically, we will turn off the panel discussion. I would like to thank all the speakers. Our project will move forward in the same way, and maybe next week we will start working on getting water. We'll try to find some financing for that. I would like to invite Victoria Mozgovaya, who's my colleague in the project. She also has a microphone, okay? We are both here, and we received the question from in YouTube.
What will happen further with the materials of this conference on Tuesday on the website socialdialogue.com.ua. You will see all the presentations during the next year, and perhaps in a 3-year perspective, we will work on the standards, bring together experts, and due to the success of the conference, we have compiled a huge database of stakeholders. We had discovered stakeholders in the region. We now have all those network, all those contacts for future implementation of our projects, and perhaps you had noticed that the topic is very important, and we hope that this social project will actually move forward. We'll have children, rehabilitation centers, treatments, and international practices, subsections within this project. And irrespectively how you participated in this conference, whether actively or passively, so to say, please join us. We plan our pilot project in Kharkiv with employment and with employment services. We may extend this pilot project on Rivne and Lviv, subject to the expressed interest. I'm very grateful to Jeanette. I'm very grateful to Sergei, and we will disseminate international experience and offer it for implementation in this government borders. And now we have a database of interested stakeholders, and this will provide us with the possibility to continue our work. I would like to thank all the participants of the conference. We gradually move to the consolidated effort, and the first results of this effort give hope, and we have determined the underlying need, that we have defined the problem, and we are all keen to find solutions to the drug addiction. It is not so easy to consolidate the efforts of the state, of the private sector, of civil society, but we all have our constitutional rights, so we should know them and insist on this on the implementation of our rights. Please remember about Article 49 of Ukrainian Constitution.